The night Ardenvale Memorial Hospital decided to humiliate her was the same night 3 military helicopters tore open the sky above the parking lot. Nobody saw it coming. Nobody except the woman they had spent 6 hours treating like furniture. She was pushing a supply cart down Corridor C when the rotors hit. A sound that didn't belong in a civilian hospital, a sound that belonged to a war zone, a sound that made the blood in your chest remember something primitive and afraid. The ER doors blew open. Armed soldiers in tactical gear flooded the lobby, carrying a man so soaked in blood he looked like something pulled from a river. The hospital director screamed for security, attending physicians backed against the walls. And the soldier leading the team, eyes scanning every face in that room with the kind of precision that had nothing to do with medicine, grabbed a charge nurse by the collar of her scrubs and said 4 words that stopped every conversation, every monitor alarm, every breath in the building. "Where's Callsign Raven?" The lobby went silent. Nobody moved. Nobody knew that name. And then the woman they had mocked for 6 straight hours, the one they'd handed a mop and told to make herself useful, set down her supply cart. She pulled off one latex glove, then the other, and she said quietly enough that the soldier had to lean forward to hear it. "You found her." If you've never seen an entire special operations team freeze at once, it looks like someone cut the power to a room full of machines. Every movement stopped. Every hand went still. The team leader, a man with a jaw like a cinder block and eyes that had clearly seen things that would dismantle a normal person, stared at her like he was recalculating something fundamental. Because they hadn't come looking for a nurse. They had come looking for the soldier who once dragged 4 of them out of a burning vehicle when no one else was coming. They had come looking for the woman whose hands had kept a man breathing for 40 minutes with nothing but field supplies and sheer refusal to accept the alternative. They had come looking for someone they were told had disappeared, and she was standing in front of a supply cart wearing hospital-issue scrubs with a mop handle leaning against her shoulder. Hit that subscribe button right now and turn on your notifications so you don't miss a single episode of this story. Stories like this one drop every week, and trust me, you do not want to be the person who finds out everyone else was watching while you were sleeping on it. Smash that like button and drop a comment below to tell me what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to the beginning, because before those helicopters arrived, this woman's night had already been one of the worst of her life. Her name was Nora Voss. She had transferred to Ardenvale Memorial 6 weeks earlier through a temp staffing agency, which meant she existed in the hospital hierarchy somewhere below the janitorial staff and the vending machine technicians. Float nurses didn't have departments. They didn't have lockers with their names on them. They filled gaps, showed up wherever they were needed, did whatever nobody else wanted to do, and disappeared at the end of a shift without anyone particularly noticing they'd been there. Nora had chosen this deliberately. That was the part nobody at Ardenvale understood, because nobody at Ardenvale knew the first thing about her. The placement agency had her paperwork, a nursing license, a background check, a series of certifications that were technically accurate but strategically incomplete. The woman who processed her application had asked if she had any specializations, and Nora had said, "General nursing, some trauma background," and left it at that. She had wanted quiet. She had wanted routine. She had wanted, for the first time in 9 years, to spend a shift without someone's life depending on the decision she made in the next 30 seconds. Ardenvale Memorial was supposed to give her that. What it gave her instead was charge nurse Diane Kopp. Diane Kopp was 43 years old, had worked the same ER floor for 11 years, and operated on the unspoken but ironclad belief that a hospital ran on hierarchy the way a clock ran on gears, and float nurses were not gears. They were the lint you picked off the mechanism to keep it running smoothly. She had the particular kind of authority that came not from competence, but from duration. She had outlasted enough supervisors and administrators that the floor had simply shaped itself around her preferences, and her preferences did not include temporary staff who showed up with no backstory and quiet eyes that had seen too much. She had assigned Nora to restocking duties at the start of the 7 p.m. shift. "We're tight on linen carts in the East Wing," Diane had said, not looking up from her tablet. "And the supply closet on C Corridor needs a full audit. Start there." Nora had said, "Sure." She had taken the cart. She had started the audit. 3 hours into the shift, a fourth-year resident named Dr. Prescott Lane had paged Diane about a patient in Bay 7, a 58-year-old man named Gerald who had come in complaining of back pain and was displaying symptoms that didn't quite add up. His pressure was off. His heart rate was elevated in a way that didn't match his stated discomfort level. Dr. Lane was young enough to be uncertain and experienced enough to know the uncertainty mattered. Nora had been restocking the cart 6 feet from Bay 7 when she heard the conversation. She hadn't meant to listen. She had been counting saline flush syringes and half paying attention to the ambient noise of a busy ER the way you learned to do when you'd spent years in environments where ambient noise could kill you if you tuned it out wrong. And something in the rhythm of what Dr. Lane was describing had made her hands slow down. She had looked through the bay curtain. She had seen the patient. She had noticed 3 things in approximately 4 seconds. The first was the way the man was holding his left shoulder. Not grabbing it, not rubbing it, just holding it in a way that looked unconscious, like a body trying to tell itself something. The second was the color of the skin around his mouth, a shade of pale that wasn't anxiety, wasn't pain, was something else entirely. The third was the sweat pattern, damp at the temples and the upper lip, but not at the neck, which was wrong for someone whose chief complaint was back pain. She had set down the saline flushes, she had pushed the curtain back and stepped inside. "His pain is radiating," she said. "It's not back pain. You need an EKG now, and you need to run troponins immediately." Dr. Lane had turned around with the expression of someone who had just been interrupted mid-thought by a stranger at a party. "I'm sorry. Who are you?" "Float nurse, Nora Voss." "But that's not the point." "No." Diane Kopp's voice came from the doorway. "The point is that a float nurse does not walk into an attending physician's bay and start calling diagnostics." Nora had kept her eyes on the patient. "The symptom presentation is consistent with, 'I heard what you said.'" Diane had stepped fully into the bay. "What I'm telling you is that this is not your patient, this is not your bay, and this is not your call. Dr. Lane has the situation handled." Dr. Lane had straightened a little, the way young doctors did when someone more senior validated their authority. "We're running a workup," he said, slightly stiff. "His troponins need to be part of that workup," Nora said. "The shoulder involvement, the diaphoresis pattern, the BP discrepancy." "Nora." Diane's voice had dropped to something quiet and very deliberate. "I need you to go back to your cart, right now." There had been a beat. Gerald, the 58-year-old man in Bay 7, had looked at Nora with the particular expression of someone who understood they were watching something that concerned them personally. Nora had looked at Diane. Then she had looked at Dr. Lane. Then she had said, "Run the troponins," and walked back to her cart. She had stood in the corridor and restocked the linen supply with her hands moving automatically and her mind doing a very specific kind of calculation. The one she'd spent years trying to shut off. The one that ran constantly in the background whether she wanted it to or not. The one that had kept soldiers alive and driven her to the edge of herself and eventually delivered her to a temp staffing agency in a mid-sized city where she was supposed to be invisible. 40 minutes later, Dr. Lane had ordered the EKG. 45 minutes later, Gerald had been moved to the cardiac unit with a diagnosis of acute myocardial infarction. Nora had heard it from the corridor. She had not said anything. She had moved her cart to the C-Wing supply closet and started the audit Diane had assigned her. The supply closet audit took 2 hours. In those 2 hours, Diane Kopp had found 3 separate occasions to materialize in Nora's vicinity and make observations. The first, float nurses are here to support the team, not practice medicine. The second, delivered to a passing orderly but clearly aimed. It's incredible how some people can't read a room. Comes with experience, I guess. The third, while Nora was reorganizing catheter supplies. I'll be putting a note in your placement file about the incident in Bay 7. Crossing professional boundaries is something the agency needs to know about. Nora had kept her hands moving. She had counted catheters. She had said, "Okay." Not because she agreed, not because she thought Diane was right, but because she had learned, in environments considerably more intense than a hospital supply closet, that some battles cost more than they were worth, and the math on this particular one didn't add up in any direction that helped anyone. The woman she had been 9 years ago would have had a different answer. That woman had called down air support from a satellite phone while performing emergency chest decompression with her knees on a man's sternum and her hands covered in blood. That woman had written incident reports that reached the Pentagon. That woman had been known by a call sign rather than a name in certain operational circles because her name had been attached to things that certain people in certain agencies preferred to keep attached to nothing at all. That woman had also come back from her final deployment unable to sleep more than 3 hours at a stretch, unable to sit in a restaurant with her back to the door, unable to watch someone drop something without her body responding before her brain did. She had traded that life for this one. Deliberately. Knowingly. Because the version of herself that existed after 9 years of combat trauma nursing wasn't someone she entirely recognized anymore, and she needed space, distance, something resembling ordinary, before she could figure out what was left. Ardenvale Memorial was supposed to be ordinary. She was counting catheters in a supply closet at 9:45 p.m. when she heard the sound that ended ordinary. It started as vibration before it became noise, a low-frequency thrum that came through the floor and walls before it hit her ears, and her body registered it before her conscious mind did. She went still. Her hands stopped moving. Something inside her chest reorganized itself into an older configuration, one she hadn't occupied in 3 years. Rotors. Multiple rotors. Close. She stepped out of the supply closet into the C corridor and looked down the hallway toward the windows at the far end. Through the glass, she could see the parking lot. She could see lights. She could see something descending that had no business being anywhere near a civilian medical center. She walked toward the windows. The first helicopter hit the ground with the kind of controlled force that told her whoever was flying it had done this before in places where doing it right was the difference between alive and not. The second came down 20 yards east. The third circled once and landed across the ambulance bay, its rotor wash scattering the 2 paramedics who had been smoking near the staff entrance. She was already moving before the doors opened, not running, walking, but walking the way she used to walk between staging areas and casualty collection points, with purpose that didn't look like urgency, but ate up ground fast. She came around the corner from C corridor into the main ER lobby. At the same moment, the external doors blew open. 4 soldiers in tactical gear entered first, hands on weapons, eyes sweeping. Behind them came 2 more carrying a man on a portable stretcher, a litter carry, the kind used in the field, not the wheeled kind that civilian EMS used, which told her this patient had come directly from somewhere that didn't have time for wheels. Behind them came the team leader. She recognized the way he moved before she recognized his face. The team leader was a man named Marcus Webb, and the last time Nora had seen him, he had been unconscious in the back of a vehicle that was on fire, and she had been the person pulling him out of it. He didn't see her yet. He was scanning the room with the systematic efficiency of someone trained to locate threats and resources in unfamiliar spaces, and his voice was already cutting through the lobby noise before his eyes finished their sweep. "We need trauma. We need it now, and we need Callsign Raven." The hospital director, a man named Philip Okafor, who had been paged from his office and arrived looking like someone had interrupted a very important email, stepped forward. "Sir, this is a civilian medical facility. You need to identify yourself and Captain Marcus Webb, Special Operations. Our man is in hemorrhagic shock. We have a penetrating thoracic injury with declining pressure, and we need the trauma bay and we need Raven, in that order, right now." Diane Kopp appeared from somewhere near the nurses' station. "I don't know what Raven means, but this is our facility, and we—" "Raven." Webb's voice cut her off without volume, which was somehow worse than if he'd shouted. "Where is she?" Nobody answered. The man on the litter made a sound, not a groan, something quieter than that, the particular quiet of a body running out of reserves. Nora had been standing at the edge of the lobby, watching. She looked at the man on the stretcher. She saw the wound location. She saw the respiration pattern. She saw the neck veins. She took off one glove, then the other, and she said, "You found her." Webb turned. The lobby went silent in the way that spaces go silent when something fundamental shifts. Not just noise stopping, but the whole atmosphere of a room recalibrating. He stared at her. He stared at the scrubs, at the supply cart behind her, at the hospital badge clipped to her breast pocket that said, Nora Voss, float nurse. He said, "Raven." Not a question. "Your man is tensioning," she said. "How long ago?" Webb's training snapped back in. Onset of respiratory distress approximately 14 minutes ago. GSW, right lateral chest exit wound absent. His pressure has been dropping since the 3rd minute. Nora was already moving toward the stretcher. Does he have a pneumo or does he have a hemopneumo? We treated for tension in the field, needle D on the right. It bought us time. How much time? We're out of it. She was beside the stretcher now, hands on the patient's neck, his chest, her eyes reading what his body was broadcasting to anyone who knew the language. Trauma bay, she said. Now. I need a chest tube tray, a size 32 French, suction, and I need whatever attending is on tonight to be in that room in 90 seconds. You're a float nurse, Diane Kopp said from somewhere behind her. Her voice had a quality to it that was trying to be authority and landing closer to bewilderment. You are not authorized to... Nora looked at the man on the stretcher. His lips were going blue at the edges. She looked back at Diane. Then come tell him that, she said. She took the front of the litter. Marcus Webb took the back. And they moved toward the trauma bay together while every person in that lobby stood very still and watched something happen that none of them had a category for yet. The trauma bay at Ardenvale Memorial was a good room. Clean, well-equipped, properly staffed on paper. What it was not, in this particular moment, was fast. Dr. Randall Hatch, the attending on duty, arrived at 94 seconds, 4 seconds over, which wasn't his fault because nobody had given him adequate warning, and he'd had to come from the other end of the building. He was a competent physician. Nora could tell that in about 8 seconds of watching him read the patient. But competent and fast weren't the same thing, and this patient's body was no longer asking for competent. It was asking for now. Talk to me, Dr. Hatch said, pulling on gloves. Marcus Webb, I'm team lead. Patient is Sergeant First Class Danny Orr, 29 years old, GSW right thorax, field needle decompression performed approximately 22 minutes ago. He partially decompressed, but pressure has continued declining. Blood pressure? One of the soldiers called it out. 82 over 50 and dropping. He's got a hemopneumo, Nora said. The needle addressed the pneumo component, but there's accumulating hemothorax on the right side. He needs a chest tube, large bore, immediately. Dr. Hatch looked at her. Float nurse, he said, not unkindly, but with the particular inflection of a question. She's the one you want in this room, Webb said from near the door. His voice carried the flatness of someone who had stopped being diplomatic approximately 2 hours ago. Hatch looked at Webb, looked at Nora, made a decision the way good doctors made decisions. Not perfectly, but quickly. Get me a 32 French chest tube kit, and someone get me a second set of hands that knows what they're doing. I'm your second set, Nora said. Diane Kopp had followed them into the trauma bay. She was standing near the door with the expression of someone watching a renovation happening in their house without their permission. Dr. Hatch, I need to note for the record that this nurse has already demonstrated a pattern of overstepping her role tonight and allowing her to, not now, Diane. Hatch said it without looking up. I need to be on record. You're on record. He looked up then. Now, either help or step back. The chest tube kit arrived. Nora opened it with hands that had done this in a tent, in a vehicle, in the open air with enemy fire providing ambient noise. She had done it with worse light, less equipment, and no backup. Her hands didn't shake. They didn't need to think about what they were doing, because what they were doing lived somewhere below thought, somewhere in the muscle memory of 9 years doing exactly this. She positioned. She explained each step in the low, steady voice she used when she needed the person next to her to be able to follow and assist without panic. Hatch watched her for approximately 4 seconds before he stopped watching and started assisting, because what he was seeing answered the question he had about her competence, and he was the kind of doctor who updated his conclusions from evidence. The tube went in. Bloody fluid began draining almost immediately. Dark, significant. The unmistakable drainage of a hemothorax that had been building pressure against the lung for the better part of half an hour. The monitor shifted. Pressure, 88 over 54, then 92. Sergeant First Class Danny Orr's oxygen saturation began to climb. 94%. 96. His color changed, not all at once, but perceptibly, the way the sky changes when a cloud moves off the sun. Something came back into his face that hadn't been there when he rolled through the doors. The room breathed. Webb was leaning against the wall near the door, his arms crossed, watching. His expression was not the expression of a man who was surprised. It was the expression of a man who had been told something would happen and had driven cross-country to make sure it did. Diane Kopp had not left. She was standing in the corner with her arms at her sides, and for the first time since Nora had arrived at Ardenvale Memorial, she was completely quiet. Nora stepped back from the patient. Her gloves were dark with what they were always dark with after a procedure like this. She stripped them and dropped them in the biohazard container without looking. "He'll need imaging, a full blood panel, and he should have a thoracic surgeon's eyes on him in the next 2 hours," she said to Dr. Hatch. "The tube is positioned well, but I'd want confirmation on the drainage rate before I'd say he's clear of surgical intervention." Hatch nodded. "I agree." He paused. "That was very well done." Nora didn't respond to that. She turned and found Marcus Webb no longer against the wall. He was 3 feet away, looking at her with the specific expression of someone who had spent a long time looking for something and still wasn't quite willing to believe they'd found it. "You were supposed to be gone," he said. "We had a last known location, Clearwater, 2 years ago. You just disappeared." "That was the idea." "We needed you." "I know." The word hung there. Not defensive, not apologetic. Just honest in the way that only came after you'd made a choice you'd had to live with long enough to stop second-guessing it. Webb looked at the supply cart still visible through the trauma bay door. He looked at the badge on her chest. "Float nurse," he said. "It has its advantages." "Like what?" She glanced toward Diane Kopp, who was still standing in the corner with the expression of someone reassessing a significant number of prior decisions. "Apparently none," Nora said. "But I'm working on it." Webb almost smiled. Almost. "What they said about you in that hallway," he said. "When we came in and asked for Raven and nobody knew, I heard. Does that happen every shift?" Nora picked up a clean pair of gloves from the tray and pulled them on. "Most of them," she said. Something moved through Webb's face. Not pity, because he wasn't built for pity, and she wouldn't have wanted it if he were. Something harder than pity and more useful. The look of a man reclassifying a situation. He looked at Philip Okafor, who had been standing near the door with the posture of someone trying to decide whether to be present or absent and failing at both. "I think," Webb said, "you and I need to have a conversation about this nurse's employment status." Okafor opened his mouth, closed it. "I think," he said carefully, "that might be appropriate." The monitor above Danny Orr showed steady vitals. The chest tube continued to drain, and somewhere in the hallway outside the trauma bay, the rest of the night staff had gathered in the gap of the open door to see what had happened, and Nora could see their faces from where she stood. The residents, the nurses, the orderlies, the people who had watched her push a supply cart for 6 hours and assumed they knew exactly what they were looking at. She didn't look back at them. She checked the chest tube placement. She noted the drainage rate. She did her job. But outside in the parking lot, 3 military helicopters were still sitting in the ambulance bay with their navigation lights blinking, and inside the hospital, Captain Marcus Webb was reaching into his tactical vest and removing a document folder that carried a classification marking Philip Okafor had never seen on a piece of paper inside his hospital. And Diane Kopp, standing in the corner of the trauma bay she had run for 11 years, was beginning to understand, with the particular dawning clarity of someone who has made a catastrophic miscalculation, that the float nurse she had sent to audit the supply closet was not, and had never been, what she appeared to be. The document folder landed on the tray table beside the trauma bay door. Webb looked at Okafor. "You're going to want to read that," he said, "before we have any more conversations about her role in this hospital." Philip Okafor did not open the folder immediately. He looked at it the way people looked at things they already understood were going to change the shape of their evening, maybe the shape of considerably more than that. And he picked it up with both hands like it had weight beyond the paper it was printed on, which in a sense it did. Nora didn't watch him read it. She was focused on Danny Orr, on the steady rhythm of the monitor above his bed. On the chest tube output she was tracking in her head the way she tracked everything, automatically, constantly, with the background processor that never fully shut off regardless of how many supply closets she stood in or how many linen carts she pushed. His pressure had stabilized at 98/62. Not good, but stable, which in the language of trauma medicine was a different word than fine, but was at least a word you could work with. Drainage is slowing, she said to Dr. Hatch, who was still in the room, standing to her left with his arms crossed and the particular expression of a physician recalibrating a prior assessment. 420 milliliters in the first 15 minutes. If it stays under 50 per hour, we can manage conservatively, but if it spikes, he'll need the OR. I've already paged thoracic, Hatch said. Good. A silence settled between them, not uncomfortable, but weighted. He was working out what to say, and she wasn't going to help him with it, because she'd spent 9 years in environments where people worked out what to say, and she had learned that the most efficient thing to do was let them work. You've placed a lot of these, he said finally. Yes. In what context, if you don't mind? I mind, she said, not unkindly. For right now, can we focus on him? Hatch nodded. He was the kind of doctor who could accept a redirect when it came from someone who had just demonstrated competence in front of him. That was rarer than it should have been. Behind them, near the trauma bay door, Philip Okafor had reached the third page of the folder. Nora heard the sound his breath made when he got there. It wasn't a gasp. It was something quieter, the sound a person made when a number came in significantly higher or lower than they were expecting, and they had to adjust the entire equation. She did not turn around. Marcus Webb had positioned himself near the wall to Okafor's right, with the patience of a man who had delivered documents like this before and knew exactly how long they took to land. He wasn't watching Okafor read. He was watching the room, all of it, the door, the staff clustered in the hallway, Diane Kopp in the corner, with the steady, comprehensive attention of someone whose job description had once literally included threat assessment. Diane had not moved. She was standing with her back to the supply cabinet, arms folded against her chest, and the expression on her face had passed through several phases in the last 10 minutes. It had started as authority. It had moved through confusion. It had settled, currently, in something that looked like a person standing at the edge of something and not yet willing to look down. One of the soldiers, a woman, compact and serious, with a medic patch on her shoulder, had positioned herself near Danny Orr's head and was monitoring his airway with the focused quiet of someone who didn't need to be told what she was doing. She and Nora had worked around each other without introduction or instruction, the way people did when they'd both trained in environments where introduction took time you didn't have. The soldier glanced at Nora once. Nora glanced back. A small nod. Not friendship, not yet. Just recognition. One professional acknowledging another across the particular language barrier of institutional affiliation. Okafor closed the folder. He held it for a moment. Then he looked at Nora's back and said, "Ms. Voss?" "It's just Nora." "Nora." He paused. She could hear him figuring out the grammar of what came next. This document, the certifications listed here, combat trauma nursing, advanced surgical assist, tactical emergency medical support, that's accurate. And the commendations, the operational service record, also accurate. Another pause, longer. Why didn't the placement agency? I didn't give them that information, she said. I gave them my nursing license and my basic certifications. That was sufficient for the role I applied for. The role you applied for, he repeated slowly, was float nurse. Yes. You applied for a float nurse position. I needed something straightforward. She checked the tube output, still tracking. Float nursing is straightforward. From the corner, Diane Kopp made a sound that was not quite a word and not quite not a word. A small, involuntary sound, the kind that escaped when the mind caught up to something the body had already understood. Webb looked at her. He didn't say anything. He didn't need to. The thoracic surgeon arrived at 11:17 p.m., a woman named Dr. Aisha Renfrew, who had been called from home and had the slightly compressed energy of someone who had dressed in a hurry but was now fully present. She reviewed Danny Orr's imaging, examined the chest tube output, ran her hands over his chest with the careful economy of motion that came from a decade of doing this, and then turned to look at the people in the room. Her eyes went to Hatch first, then to Nora, then to the soldiers near the door. Who placed the tube? She asked. Hatch said, Nora Voss. Renfrew looked at Nora. "Float nurse," Nora said, before Renfrew could ask. Renfrew looked at the tube placement, at the positioning, at the output numbers on the collection chamber. She said, which was a word that contained a complete sentence. She consulted with Hatch for 4 minutes about monitoring parameters and surgical thresholds, and came to the conclusion that Danny Orr did not need the OR tonight, that the hemothorax was draining adequately and his pressure was responding, and that what he needed was an ICU bed, continuous monitoring, and someone competent watching the tube output through the night. "I want hourly checks," she said. "If the output exceeds 80 per hour or his pressure drops back below 90 systolic, I want a page immediately." She paused. "Who's doing overnight monitoring?" There was a brief silence that was about staffing logistics and the awkward reality that the ICU charge nurse for the night shift had not yet been briefed on any of this and was going to have questions. "I'll take the first 4 hours," Nora said. Renfrew looked at her. "Your float staff?" "Yes." "You're comfortable with this level of monitoring?" Nora held her gaze for a beat. "Yes," she said. Something in Renfrew's face shifted into a different register. Not doubt, not suspicion, just the practical recalibration of someone updating a prior assumption from new information. She nodded once, the nod of a surgeon who had made a decision and was prepared to move past it. "Page me if anything changes," Renfrew said, and left the room. Diane Kopp watched her go. Then she looked at Nora. "You can't volunteer yourself for ICU monitoring," she said. Her voice was trying to rebuild something and not quite finding the materials. "Float nurses don't have standing assignments. They're assigned by charge staff, which means, Diane." Webb spoke from the wall. He said it calmly, the way you said a word that was both a name and a stop sign. Diane looked at him. Webb looked at Okafor. Okafor was still holding the folder. He looked at Diane and said, "I think we should let her, Mott." The ICU on the 3rd floor of Ardenvale Memorial was quieter than the ER in the particular way of places where the emergencies had already happened, and what remained was the long work of holding ground. It smelled like antiseptic and recycled air, and the faint metallic undertone that no hospital ever fully got rid of, regardless of how much they cleaned. Nora settled Danny Orr into Bay 4 just after midnight. Webb came with them. So did the medic from his team. Her name was Specialist Yara Oden, Nora learned eventually, because Yara introduced herself in the elevator with a handshake that was firm and brief and professional, and said, "You're everything he said you were." And Nora had replied, "He oversells." And Yara had said, "He really doesn't." And that had been the end of that conversation. The first hour was work. Pure, focused, uncomplicated work. The kind Nora was good at, and had always been good at. The kind that required all of her attention and left no space for anything else. Tube checks, pressure checks, blood draw for the repeat panel Renfrew had ordered, medication reconciliation, documentation. The rhythms of critical care monitoring were the same rhythms she had run on deployments, stripped of the gunfire and the dust and the particular insanity of performing medicine in places that were actively trying to kill everyone present, including the medics. Webb sat in the chair near the door and said nothing for most of the first hour. He watched her work the way she remembered him watching the world in general, completely, without the appearance of watching, with the peripheral comprehensive attention of someone who had survived by never stopping. Sometime around 1 a.m., when Orr was stable and the bay was quiet, and Yara had stepped out for coffee, Webb said, "You know they're going to make this into a thing." "I know. The hospital, the charge nurse, the director, they're going to have to figure out what to do about the fact that they had you restocking supplies. That's their problem. It's going to become your problem." Nora made a note in the chart. "Everything becomes my problem eventually. That's not new." Webb leaned forward with his elbows on his knees. He had the posture of a man who was physically large and had learned to make himself smaller in chairs because otherwise chairs were not entirely functional for him. "Raven, I need you to hear something." "I'm listening." "We didn't come here just for Danny." She stopped writing. She looked at him. "The mission we were running," he said, "went wrong in ways that are above my pay grade to explain without clearance you no longer technically have. But what I can tell you is that there are 4 other people, other soldiers, and they're in situations that are going to require someone with your specific combination of skills in the next 72 hours. The monitor above Danny Orr beeped once in a routine rhythm. I'm not in the military, Nora said. I know. I separated, honorably, 3 years ago. I know that too. Then you know I don't. I know what you said when you left, Webb said. I was there for some of it. And I understood it then, and I understand it now, and I'm not here to argue with any of it. He paused. But the 4 people I'm talking about need someone who knows how to do what you just did, in conditions that are going to be significantly less comfortable than this ICU. Nora looked at the chart in her hands. She looked at Danny Orr's face, young, slack in sleep, color better than it had been 2 hours ago, breathing on his own with the tube doing what tubes were supposed to do. I don't have my gear, she said. We have gear. I don't have clearance. We're working on it. Webb. Nora. She set the chart down. You are asking me to walk away from a patient who is not yet stable. I'm asking you to consider it. Tonight. There's time. She looked at him for a long moment, the particular kind of long moment that contains a significant amount of history. Let me get through the night, she said. Let me make sure he's clear of the danger window. Then we talk. Webb nodded. He sat back. He didn't push. That was the thing about Webb that she had always respected and occasionally found infuriating. He knew exactly when to stop talking, which was a skill that approximately 1 in 50 people actually had. The thing about the night shift was that it had its own gravity. It pulled at things that the day shift kept properly submerged. It created silence in the wrong places and amplified sounds that should have been background. It was the shift during which, in Nora's experience, people either found their footing or lost it, because there was no performance to maintain and no audience to maintain it for, and the work was just the work, and you were just yourself doing it. She had worked more night shifts in her life than she could count. She had worked them in places that required body armor. She had worked them in places where the power went out and you finished a procedure by headlamp. She was working this one in a hospital with functioning lights and a stable patient and a chair she could have sat in if she had been the kind of person who sat, which she was not during monitoring hours, not when she was responsible. At 2:14 a.m., Danny Orr's pressure dipped. Not dramatically, not alarmingly, but enough. Nora was at the bedside before the monitor had finished its second alert cycle. She ran through the checklist with the speed and completeness of someone who had run it in considerably worse conditions. Tube position, unchanged. Drainage, within parameters, slightly increased but not at threshold. Respiratory rate, elevated. Oxygen saturation, holding. She paged Renfrew. She did not wait for Renfrew to arrive before she started moving. She increased the IV fluid rate by 15%, a judgment call that lived in the gray zone between nursing scope and physician territory, the kind of call that required you to be right about what you were seeing and wrong about it at the same time, which meant it required confidence in your read of the situation and the understanding that confidence was not the same as certainty, and you were always working with incomplete information. Renfrew arrived in 8 minutes. She reviewed the numbers. She reviewed what Nora had done. Good call on the fluids, she said. She said it the way surgeons said things they respected. Quickly, without ceremony, moving directly on to the next thing. I want a repeat chest x-ray. Already ordered, Nora said. Renfrew looked at her again with the expression she'd had in the trauma bay. The one that was doing math. Where did you train? She asked. Multiple places? Military? Among others. Renfrew made the hum sound again. She looked at the chart. She looked at the fluid adjustment Nora had made. This is outside nursing scope. Yes. You made the call anyway. His pressure was dropping and you were 8 minutes out. A beat. His pressure is better, Renfrew said. Yes. Another beat. Renfrew had the quality of a person deciding something and being honest with herself about what the decision was actually based on. I'm going to note in the chart that I ordered the fluid adjustment, she said. Nora looked at her. That's not accurate, Nora said. No, Renfrew agreed, but it will protect you from a scope of practice complaint. Dr. Renfrew, I'm not asking you to lie, Renfrew said, with the particular precision of a woman who had made decisions like this before and had a framework for them. I'm telling you what I'm writing in my note. You can write what you like in yours." She paused. "But I'd think carefully about what you write, because the charge nurse from the ER has already submitted a formal complaint about you to hospital administration, and it's going to land on the director's desk in the morning." Nora was quiet for a moment. "What kind of complaint?" she asked. "Unauthorized medical decision-making, overstepping scope, the cardiac patient from earlier tonight, the one who went to the cath lab." Renfrew kept her voice neutral, clinical. "She's arguing you interfered with a physician's care plan and caused unnecessary alarm. I told the resident to run troponins. And the patient had an MI." "Yes. And that's the problem," Renfrew said, not unkindly. "Because the charge nurse's position is that the resident was already running a workup, and your intervention was unauthorized, and if the outcome had been different, it would have exposed the hospital to liability. She's framing it as a pattern." The word pattern sat in the air between them. Nora understood it. She understood the architecture of it, the way it connected the cardiac patient to the trauma bay to tonight, how it built a case from fragments that individually could be explained away, but together formed something with shape and weight. She understood because she had seen this structure before, not in hospitals, in briefings, in the particular way institutional machinery assembled evidence against people it wanted to remove. "She's not wrong about the scope issue," Nora said. "No," Renfrew said. "She's not, but she's using a procedural argument to cover something else. And we both know it." She checked Danny Orr's chart one more time. "He's stable. The X-ray will confirm. Try to get a few minutes off your feet." She left without waiting for a response. Nora stood at the bedside and looked at Danny Orr. He had a tattoo on his left forearm, a date, numbers, without explanation. He looked younger asleep than he had when he was in danger. He looked like someone's kid brother. She had seen that before, too. She pulled the chair from the corner of the bay and sat in it, which was something she almost never did during monitoring hours. And she sat in it because her legs were doing that thing they did occasionally when the adrenaline finished metabolizing and the body remembered it had been awake for 19 hours. She sat in it and looked at the monitor and thought about Diane Kopp's complaint. She thought about what Okafor would do with it in the morning. She thought about Marcus Webb's request. She thought about the 4 people he hadn't named yet. She thought about the supply cart in C Corridor that still had half a linen audit sitting unfinished on it, which was, under the circumstances, possibly the least important thing in the building, and yet was the thing her brain kept returning to because it was the last normal thing she had been doing before everything became what it had become. She had been counting saline flushes. She had been trying very hard to be ordinary. At 4 a.m., Yara Odin came back with 2 cups of coffee from the nurses' lounge. She handed one to Nora without asking if Nora wanted it, which Nora found both presumptuous and correct. "Webb's asleep in the family waiting room," Yara said, settling into the second chair. "He does that. Goes from full operational mode to unconscious in about 90 seconds. Combat sleep," Nora said. "You do it too?" "Used to. Takes a while to unlearn." Yara held her coffee cup with both hands. She was younger than Nora had initially estimated, late 20s maybe, with the kind of composed steadiness that either came from experience or was going to get tested by it soon enough. "He talked about you," Yara said, "before we found you. Not all the time. But sometimes, when things got tight, he'd say there was a protocol he used to have that he didn't have anymore." She paused. "We didn't know what Raven meant exactly. We knew it was a call sign. We knew it was a person. We knew that Webb thought this person was the best trauma nurse he'd ever worked alongside." Nora said nothing. "I've been doing tactical medicine for 4 years," Yara continued. "I'm good at it. I know I'm good at it. But what you did in that trauma bay tonight," she stopped, started again. "That was a different level." "You would have gotten there," Nora said. "Eventually." He might not have. The monitor beeped in its regular rhythm. Nora drank her coffee. It was bad coffee. Thin and overbrewed and slightly bitter in the way of coffee made in a machine that was cleaned infrequently. And it was exactly what she needed. "The request he made," Yara said. "The 4 people." "He told you?" "He tells me most things. I'm his second." She looked at Nora with eyes that were direct without being aggressive. "I'm not here to pressure you. I just want you to know it's real. What he described, The situation these people are in. I believe him. Do you believe it enough to... I said I'd talk to him after the night. Nora set her coffee down. That's where we are. Yara nodded. She didn't push. They sat in a companionable silence that wasn't quite comfortable and wasn't quite not. The silence of two people who had been thrown into proximity by circumstances rather than choice and were navigating the distance between professional respect and personal familiarity. At 4:47 a.m., the ICU doors opened. Nora expected the night nurse. She expected the X-ray tech coming for Danny Orr's repeat chest film. She expected, in the less examined part of her mind, possibly Renfrew doing a third check. She did not expect Diane Kopp. Diane was not in scrubs. She had changed into street clothes, jeans, a dark jacket, which meant she had gone home at the end of her shift and then come back, which was strange enough to be notable. She stopped in the doorway of Bay 4 and looked at Nora, sitting beside Danny Orr's bed with a coffee cup and the chart on her knee. She looked older than she had in the ER, or maybe she just looked like what she was, which was a person who had been awake for too long and was carrying something she hadn't expected to carry. I need to tell you something, Diane said. Nora waited. Diane came into the bay. She didn't sit. She stood near the foot of the bed and looked at the monitors and then at Nora with the expression of someone who had rehearsed a conversation and was now discovering the rehearsal wasn't adequate. The cardiac patient tonight, she said. Gerald. I know who Gerald is. He's my uncle. The bay was very quiet. He transferred from Clearwater 2 weeks ago, Diane said. He's been my patient, my responsibility, ever since. Not officially, but he's family. And when he came in tonight with back pain, She stopped. Her jaw moved slightly. I was managing it. I had it handled. Diane, I know what you saw. I know you were right. The words came out with the difficulty of something that had been compressed and was releasing under pressure. The troponins, the shoulder, all of it. I know. She paused. But in the moment, I saw a float nurse walking into my uncle's bay without invitation, and Another stop. I reacted, and I made it worse. And then I compounded it in the trauma bay because I'd already started and I didn't know how to... She stopped again. Nora looked at her. Diane Kopp was not a villain. Nora had understood this somewhere in the middle of the night, in the way you understood things during long monitoring hours when your mind ran over recent events with the dispassion of exhaustion. She was a woman who had been in the same institution for 11 years and had developed the particular calcified authority of someone who had mistaken duration for wisdom and who had been frightened tonight in a way she hadn't expected. Frightened for her uncle, frightened of being wrong in front of people she supervised, frightened of a stranger who walked into her floor and somehow saw things faster than she did. Fear made people smaller than they were. It had made Diane smaller than she probably was. The complaint you filed, Nora said. With administration. Diane's face shifted. Can you withdraw it? A pause. Yes, Diane said. Will you? The pause this time was longer. Yes, she said. I'll call Okafor's office when it opens. Nora looked at her for a moment. Then she said, How is he? Your uncle. Something crossed Diane's face. Not relief exactly, but the nearest neighbor to it. The relaxation of a muscle that had been clenched for hours. They said he's going to be okay, she said. The cath lab team. She stopped. They said if he'd presented much later... She didn't finish that sentence. She didn't have to. Nora nodded. He came in at the right time, Nora said. Which was true. Which was also deliberately not. And you should have listened to me sooner. Because that sentence served nothing except the satisfaction of being right. And she had stopped being interested in that kind of satisfaction somewhere around her second deployment. Diane looked at her. Who are you? She said. Not hostile, genuinely asking. The question of a person who had had their map of a situation revised significantly and was trying to reorient. Float nurse, Nora said. Diane almost smiled. There was something sad in it, not self-pitying, just honest. Right, she said. She left the way she had come. Nora watched the door close behind her. She sat in the chair with her bad coffee and the chart on her knee and the monitor singing its steady rhythm above Danny Orr's bed. Outside the bay windows, the sky was beginning to do the thing it did at 5 a.m. in late autumn. Not quite lightning, just becoming a different, slightly less complete shade of dark. Webb appeared in the doorway at 5:12. He had the specific look of a man who had slept in a waiting room chair, creased in the wrong places, slightly asymmetrical, more human than he usually appeared. He assessed the room in one sweep and then crossed to the chair against the opposite wall and sat in it. "How is he?" asked, meaning Danny. "Stable, holding. And you?" "Same." Webb looked at the window, at the almost not dark outside. "I got a call 20 minutes ago," he said. His voice was different, not flat. Webb's voice was always somewhat flat, but flatter. The particular flatness of someone delivering information they have already metabolized and are now delivering with appropriate control. "One of the 4 people I mentioned," he said. "The situation has changed." Nora set the chart down. "How?" "The location has been compromised," he said. "We have approximately 18 hours before it becomes untenable." He looked at her directly. "Which means, if you're going to be there, I need to know in the next 2 hours, because we leave at 7. The monitor beeped. The almost dawn light pushed at the windows. Nora looked at Danny Orr's face, stable, breathing, color-holding, and she did the calculation she had been doing all night, the one that kept arriving at the same answer no matter how many times she ran it. "There are conditions," she said. "Name them." "I need to brief Renfrew before I leave. He doesn't get handed off to someone who doesn't know his history." "Done. I need to know what I'm walking into before I'm in it. Full operational picture." "As much as I'm cleared to give you, yes." "And when this is finished," she said, "I come back here." Webb looked at her. "To the hospital?" he asked. "To this life," she said. "Whatever this is, I'm not—" She stopped, found the right words. "I am not re-enlisting, Webb. This is a specific thing, for specific people, and then I'm done." He held her gaze. "Understood," he said. She nodded. She looked at the monitor one more time. 2 hours, she said. She picked up the chart. She began writing the handoff notes she would need Renfrew to have. Detailed, precise, nothing left out, because Danny Orr deserved someone who understood exactly what the night had been. And at the very bottom of the chart, in the space marked Monitoring Notes, Float Staff, she signed her name. Nora Voss. Float Nurse. Because that was still, technically, what the badge said. And somewhere in the hallway outside the ICU, the early morning staff were beginning to arrive, and among them was a nursing supervisor named Brian Tull, who had come in early specifically because Philip Okafor had sent him a text at 3 a.m. with a photograph of 2 pages from the document folder Marcus Webb had left on the trauma bay tray. Pages that Brian was now reading on his phone as he walked toward the elevator, stopping in the middle of the hallway with other staff flowing around him, reading the same 2 pages twice because the first time he read them, he wasn't sure he understood what he was reading. He read them a 3rd time. Then he called Okafor. It was 5:23 a.m. Okafor picked up on the 2nd ring. "I'm looking at it," Brian said. "I know." "This is her?" He was still standing in the middle of the hallway. "The float nurse? This is actually her?" There was a brief pause. "She stabilized a special operations soldier with a hemopneumothorax tonight using a technique she apparently executed in approximately 4 minutes," Okafor said. "So yes, that's her." Brian looked at the pages on his phone, at the commendations, at the classification markings he didn't entirely understand but understood enough, at the operational service record that covered 9 years of work in places that weren't on public maps. "And we had her restocking linen carts," he said. Okafor didn't answer right away. Then he said, "Brian, I need you to find out which other hospitals in the region this temp agency covers." "Why?" "Because I want to know if there's any chance she applied here specifically," Okafor said, "or if we were just lucky." Brian looked at the phone. He looked at the pages. He thought about the sequence of events that had put this woman in a supply closet on C Corridor at 9:45 p.m., and he thought about the sequence that had put her in a trauma bay at 10:12, and he thought about the chest tube and the cardiac patient and the long night that had apparently followed, and he thought about all the shifts before tonight, 6 weeks of them, during which she had presumably been doing what she said she was doing, which was counting saline flushes and pushing equipment carts and filling every gap nobody else wanted. "I'll find out," Brian said. He walked toward the elevator. And in Bay 4 of the ICU, Nora Voss was finishing her handoff notes with 2 hours left before she needed to make a decision she had already made, but wasn't yet ready to say out loud. The handoff notes took 40 minutes. Not because the clinical picture was complicated. It was, but Nora had written more complex handoffs under significantly worse conditions. But because she was writing them for someone who hadn't been in the room, which meant every decision needed its reasoning, every parameter needed its baseline, every contingency needed its threshold and its response protocol. She wrote the way she had been trained to write in environments where incomplete documentation could kill the next person who touched the patient. Renfrew arrived at 6:08. She read the notes standing up, which was how she read everything. She had the posture of a person who considered sitting down a commitment she wasn't prepared to make. She read in silence. She turned pages. She went back to the second page twice. "You flagged 3 potential escalation windows," she said. 2 are low probability. The third, if the drainage rate increases past 80 per hour in the next 6 hours, I'd want imaging before you make the call on surgical intervention. His coagulation profile from the 4 a.m. draw was borderline. "I see it." Renfrew looked at the most recent vitals on the monitor. "You're leaving." It wasn't a question. "Yes." "When?" "Less than an hour." Renfrew set the chart down on the bedside table. She looked at Danny Orr, who was asleep with the particular boneless quality of someone whose body had finally stopped fighting and was using the reprieve to recover. "Is this related to them?" she asked, with a slight tilt of her head toward the doorway, where Yara Odin was visible in the hallway, running through a gear check on a bag that contained things that were clearly not standard nursing equipment. "Yes." "Are you going somewhere dangerous?" Nora considered the question with the same honesty she applied to medication dosages. "Probably." Renfrew looked at her. She was a thoracic surgeon in her late 40s who had spent 11 years at Ardenvale Memorial and probably had her own internal catalog of things she'd seen that she didn't discuss at dinner parties. She had the quality, rare in any field, of being honest about what she was looking at, even when what she was looking at was inconvenient. "He's in good hands," Renfrew said finally. "The night notes are thorough. I'll take it from here." "Thank you." "Don't thank me." She picked the chart back up. "Come back in one piece. I have questions about your chest tube technique that I want answered when there's time." Nora almost smiled. She took one more look at Danny Orr. Then she walked out of the bay. Webb was in the hallway with Yara and 2 other soldiers whose names Nora had not yet collected. He had changed into clean tactical gear that had materialized from somewhere, and was carrying a bag she recognized as a jump medical kit, the civilian equivalent of what she had carried on deployments, packed for field emergencies rather than hospital settings. He handed it to her without ceremony. "Yours," he said. "Yara configured it based on the mission parameters. Review it in transit and flag anything you need that isn't there." Nora took the bag. It had the weight and density of something packed properly, nothing loose, nothing wasted. "Where are we going?" she asked. "Briefing in the vehicle. We need to be moving." He looked at her scrubs. "Yara has a change of clothes." "I figured." They moved through the ICU corridor toward the stairwell rather than the elevator. Force of habit for all of them, she suspected. The preference for routes that didn't require waiting and didn't confine you. The early morning staff they passed in the hallway looked at the small group of them with the particular expression of civilian hospital employees encountering something they didn't have a category for and weren't sure how to file. Nora was still wearing her float nurse badge. She didn't take it off. She didn't know why, exactly. Maybe because it still felt accurate in some way she hadn't fully resolved. Maybe because removing it felt like closing a door she wasn't ready to close. She tucked it into the breast pocket of the scrubs she was wearing and pushed through the stairwell door. The vehicle was a dark SUV parked in the ambulance bay, which had apparently been cleared for them by whatever authorization the document folder represented. A second vehicle was idling behind it. Webb took the front passenger seat. Nora took the rear with Yara, and one of the soldiers she now understood was named Kellan, a tall, quiet man in his early 30s who had the stillness of a person very comfortable with waiting and who reviewed a tablet throughout the drive without looking up. The briefing was efficient. Webb delivered it facing forward, which was a habit Nora recognized from operational environments where the person with the information talked, while everyone else maintained visual coverage of the surrounding area, even in a moving vehicle, because habits were what kept you functional when the environment stopped cooperating. The mission that had gone wrong involved a surveillance and extraction operation in a semi-rural area approximately 90 minutes outside Ardenvale. She didn't need to know more than that, and Webb didn't offer more than that. What she needed to know was the medical picture. 4 personnel, one with a penetrating abdominal injury that had been field treated but was now approximately 16 hours old and deteriorating, one with a traumatic fracture and vascular compromise to the lower leg, 2 with injuries that were painful but stable, burns, lacerations, 1 probable concussion. The abdominal case, Nora said. What was the field treatment? Wound packing, Israeli bandage, IV access. He's been on fluids since the injury. What's he been on for pain? Morphine. We're almost out. 16 hours is a long time to manage a penetrating abdominal injury in the field. Yes, Webb said. It is. What's the evacuation plan? That's the problem. He turned slightly in the seat. The location compromise I mentioned. We can't extract from the primary site. We're moving them to a secondary location approximately 12 kilometers east. But the move itself is going to be a medical problem. Moving an abdominal trauma 16 hours out in a field vehicle over 12 kilometers is more than a medical problem, Nora said. I know. You need an OR, not a field nurse. I know that too. What I have is you. He looked at her without apology. And I need to know what you can do with what you have. She looked at the jump kit in her lap. She thought about what Yara had said she'd packed and what she'd seen when she unzipped the front pocket in the stairwell, the configuration of the supplies, the priorities embedded in the packing choices. I can stabilize him for transport, she said. I can manage the vascular case if it hasn't already progressed to compartment syndrome. I cannot do surgery in a field environment. I know. If his belly has had 16 hours to develop peritonitis, I know, Nora. The word landed in the vehicle and settled there. She looked out the window. The city was giving way to highway and then to the kind of semi-rural corridor that existed on the edges of most mid-sized cities. Strip developments and empty lots and then suddenly trees, the transition happening fast the way it always did. How bad is the abdominal case? She said. Honest assessment. A beat. Bad, Webb said. They reached the secondary location at 7:41 a.m. It was a structure that had been something agricultural once, a barn or a processing facility, Nora wasn't entirely sure, converted partially into storage and now being used as a staging area in the way of places that were useful precisely because nobody was looking for them. It was cold inside. Not dangerously cold, but the kind of cold that settled into a patient's core and compounded everything else. The 4 casualties were in the rear section of the building. Nora assessed them in order of priority, moving the way she moved during mass casualty triage. Fast, systematic, hands-on, building the picture in the first 30 seconds and revising it as she went. The concussion case was ambulatory and oriented. She flagged him for monitoring and moved on. The burn and laceration case had 2 partial thickness burns on the left forearm and a sutured laceration on the jaw that had been done competently in the field. She checked the suture line, confirmed no infection signs yet, noted the burn needed proper dressing rather than the field dressing currently on it, and moved on. The fracture case was a woman named Torres. Nora got the name from Yara before she reached the patient. 26 years old, left tibial fracture from a fall, field splinted. The problem was the distal pulse. Nora found the dorsalis pedis on the right side immediately. On the left, she pressed, repositioned, pressed again, and found something faint and inconsistent that made her jaw tighten. How long ago did the pulse change? She asked. Torres was awake and maintaining, the way soldiers were trained to maintain, but the lines around her eyes were the lines of someone who had been holding against significant pain for hours. I don't know exactly, 6 hours maybe more. Can you feel this? Nora pressed on the dorsum of the left foot. Sort of. It's Torres stopped. Less than I want. That was a clean answer. Nora appreciated it. I'm going to need to adjust the splint, Nora said. It may be compressing the anterior compartment. This is going to hurt. Do it, Torres said, without hesitation, in the voice of someone who had already had a worse conversation with pain than this one. Nora adjusted the splint carefully, repositioning the padding, releasing the circumferential wrap by 40%, and redistributing the support. It took 6 minutes. She checked the pulse after. Better. Not right, but better. Stronger and more consistent, which meant the vascular compromise had a positional component rather than being purely structural. That helped, Torres said. The lines around her eyes had eased slightly. Somewhat. You need imaging and possibly a vascular consult, but this buys you time for transport. She looked at Torres directly. The leg is not okay. I want you to understand that. But it's better than it was 60 seconds ago, and I'm going to keep monitoring it. Torres nodded. Nora moved to the abdominal case. His name was Sergeant First Class Dominic Reyes, 31 years old, and she knew before she reached him that Webb's assessment of bad had been accurate and possibly conservative. He was lying on a cot with an IV running wide open, blankets over him despite the effort someone had made to manage his temperature, and his face had the particular quality of a person who had been fighting a physiological battle for a long time and was aware the fight was shifting in a direction they didn't prefer. His skin was pale in the way that had nothing to do with his complexion and everything to do with perfusion. He was tachycardic. She could see it in the pulse at his neck without touching him. His abdomen, when she carefully lifted the bandaging and examined the wound, showed the edges of early peritoneal irritation. Guarding, involuntary, the muscles doing what muscles did when the peritoneum was inflamed. 16 hours. She kept her face neutral. Hey, she said to Reyes. He looked at her. His eyes were clear. That was something. He was present, oriented, working hard. I'm Nora. I'm going to take care of you. Okay, he said. His voice was steady. The steadiness cost him something. She could see that, but he maintained it. I'm going to ask you some questions, and I need honest answers, not soldier answers, medical answers. The corner of his mouth moved. What's the difference? Soldier answers tell me you're fine. Medical answers tell me where the fine ends. He made a sound that might have been a laugh if he'd had more to spare. Fair. She asked him through the pain scale, the character of the pain, the progression over the last several hours, the last time he'd urinated and what it looked like, the fever timeline. He answered all of it honestly, in the straightforward way of someone who had crossed the threshold where maintaining a front became less important than getting accurate help. The picture that emerged was what she'd expected, and worse than she'd hoped. She stood up from the crouch beside his cot and found Webb 2 meters behind her. He needs an OR, she said, keeping her voice low. I know. Not eventually. He needs it in the next 4 to 6 hours, or the math starts to change significantly. What does that mean? It means sepsis is already developing, and the window for surgical management of whatever is leaking in there is finite. She held Webb's eyes. I can support him for transport. I can optimize his fluid status and manage his vitals and try to hold the line. But what's happening in his abdomen requires a surgeon and a sterile environment, and I'm not going to pretend otherwise. Webb looked at Reyes. Something moved through his face. Not unfamiliar to Nora, who had seen it many times in the faces of commanders in the field. The particular expression of someone making a calculation that involved a human life and came out to an answer they didn't want. There's a level 2 trauma center 40 minutes out, Webb said. Clearwater Regional. We can have transport in 20. Does the location compromise extend there? That's what I'm trying to determine. He pulled out a phone. Give me 5 minutes. You have 3, she said. His pressure is borderline. I'm not going to have a stable patient in 20 minutes if we don't move. Webb was already on the phone. Nora went back to Reyes. She adjusted his IV rate, calculated in her head what she had in the jump kit for pressure support, made 3 decisions in rapid succession about fluid management that she would normally have an attending physician sign off on, and made now because there was no attending physician, and because Reyes needed the decisions made, and because in 9 years of combat trauma nursing, she had learned that the alternative to making decisions without authorization was patients who died while you waited for authorization. She worked. It was not clean work. It was not the kind of work that looked like the work in medical dramas or hospital brochures. It was messy and it was imprecise, and every decision she made had an acceptable confidence interval of maybe 75% because she was working with field supplies, an incomplete monitoring, and a patient she had known for 11 minutes. She made the decisions anyway. 75% was what she had, and 75% was what Reyes had, and she was going to use all of it. Webb's 3 minutes became 7. She didn't say anything when he came back because she was in the middle of assessing Reyes's repeat vital signs, and the numbers required her complete attention, and whatever expression her face produced during that assessment communicated adequately without words. "Clearwater is clear," Webb said. "We have a trauma team on standby. The hospital administrator has been briefed." "Which administrator?" "Medical director level. It came from above me." She filed that away. "We need to move him carefully, not fast. Carefully. Any significant increase in intra-abdominal pressure during transport is going to be a problem." "Understood." "He should not be jostled. The vehicle needs to stay under 60 on any surface that isn't completely smooth. If anyone drives like they're trying to make time, they will be responsible for the outcome, and so will I, and I would prefer not to be." Webb almost smiled. It was a small movement. "I'll drive." They moved Reyes 20 minutes later. A controlled process, nothing rushed. Kellen and one of the other soldiers managing the litter transfer with the precision of people who had done litter carries before in conditions that made this look straightforward. They loaded Torres as well. The concussion case and the burn case could travel sitting up in the second vehicle. Nora rode with Reyes. Yara rode with her. They had 40 minutes. She used all of them. Clearwater Regional Medical Center was larger than Ardenvale and had the particular organized intensity of a facility that had been alerted and was ready. The trauma team met them at the bay doors. A senior physician named Dr. Hollis Vance leading, 2 residents flanking, a surgical scrub tech already gloved at the rear. Vance was in his 50s, silver-haired, and had the compressed competence of someone who had been running trauma bays since before some of his residents were born. He took Nora's verbal handoff in 90 seconds, asked 2 sharp questions about the peritoneal exam and the fluid response, listened to the answers, and said, "We're going straight to the OR. What's her read on surgical access?" The resident he was talking to looked confused. "Her," Vance said, with a slight nod toward Nora. "What's your read?" "Right lower quadrant primary, but he has guarding across the whole lower abdomen. I'd want laparoscopic first look before committing to access." Vance nodded. "Agreed." He was already moving with the gurney. "You're staying?" "Yes." "Good. I want you in the family room for updates. If my surgical team has questions about the field course, I want someone who can answer them." He disappeared through the OR doors. Nora stood in the trauma bay corridor. Yara appeared beside her. They stood there for a moment. The adrenaline was metabolizing, which was always the ugly part. The body unwinding from the state it had been in, and the mind catching up to what the last several hours had actually contained. Torres had been taken to radiology. The concussion case was in the neuroassessment room. The burn case was being dressed by a wound care nurse. Everyone was in the right hands. Nora sat down on a bench in the corridor. She sat there and looked at the floor and did not think about anything in particular for approximately 90 seconds, which was the closest she came to rest in operational environments. Then she thought about Ardenvale Memorial. She thought about Danny Orr's chart, and Renfrew reading her notes, and Brian Tull calling Okafor at 5:20 in the morning. She thought about Diane Kopp standing at the foot of that ICU bed in street clothes at 4 a.m. saying, "He's my uncle." She thought about the float nurse badge in her breast pocket. She took it out and looked at it. Nora Voss, float nurse, Ardenvale Memorial. Webb found her an hour later in the family waiting room with a vending machine coffee. She wasn't drinking, and the jump kit open on the seat beside her because she had been running an inventory of what she'd used and what needed to be restocked for no reason, except that it was something to do with her hands. He sat down across from her. Reyes is in surgery, he said. Vance said 2 to 3 hours. He thinks they got there in time. The 4 to 6 hour window held. Barely. Barely counts, she said. Webb looked at the jump kit inventory she had been writing on the back of a hospital pamphlet because she didn't have anything else to write on. Is that a resupply list? He asked. Old habit. He sat back. He had the look of a man who was operating on 3 hours of sleep and was managing it adequately because this was not unusual for him, but who was also carrying something he hadn't put down yet. Okafor called me, he said. Nora looked up. When? 40 minutes ago, while you were working. He paused. He wanted to know where you were. He said there's a situation at Ardenvale he needs to discuss with you. What kind of situation? He didn't specify, but he said it was time-sensitive and that it involved the placement agency and your employment status. Webb's eyes were steady on her. He also said that the nursing supervisor, Brian Tull, had pulled your staffing record and compared it to the system and found some kind of discrepancy in how your certifications were filed. Nora was quiet for a moment. Which certifications? She said. He didn't say. She looked at the pamphlet in her hand, the inventory list. She thought about the paperwork she had filed with the placement agency 6 weeks ago, the deliberate omissions, the strategic incompleteness of a record that told the truth without telling all of it. It's not illegal, she said. I know. Omitting credentials isn't falsification. I know that too. Webb paused. But depending on what Tull found and how Okafor interprets it, it could be grounds for termination of the placement contract, which would mean you couldn't work at Ardenvale. The word termination sat in the institutional fluorescent air of the waiting room. Nora looked at it. She had chosen Ardenvale the way she had chosen everything in the last 3 years, carefully, deliberately, with specific criteria. It was 40 minutes from the city where she had rented an apartment. It was large enough to provide genuine caseload, but not so large that every shift was a managed disaster. It had a trauma bay that was competent without being elite, which meant the work was real without requiring her to be what she had been before, which was the whole point. She had wanted ordinary. She had chosen that hospital specifically to give herself ordinary. When does he want to talk? She asked. He's available now, or whenever you can. She looked at the waiting room door, at the OR wing beyond it, where Dominic Reyes was on a table with Hollis Vance working the problem she had bought him time to solve. I'll call him when Reyes is out, she said. Webb nodded. He didn't push. That was still the thing about him. They sat in the waiting room with the vending machine humming in the corner and the fluorescent lights doing what fluorescent lights did. And outside the windows of Clearwater Regional, the late morning was bright and ordinary and completely unaware of anything that had happened in the last 12 hours. At 11:47 a.m., Vance came through the waiting room door in his surgical cap with the specific posture of a man who had done what he came to do. Perforated small bowel, he said. Early peritonitis not established. We cleaned it up. He's going to recover. He looked at Nora. Another 2 hours and we'd have been having a different conversation. I know, she said. The field management bought him that window. He paused. Whoever made those calls in the field made the right ones under the circumstances. She did, Webb said. Vance looked at Nora with the expression she was becoming familiar with. The recalculation expression, the one that appeared on the faces of physicians when they updated a prior model. I'd like to consult with you on the post-op course, he said, if you have time. I have time, she said. She stood up. She put the float nurse badge back in her pocket. She followed Vance toward the OR suite, and behind her she heard Webb's phone ring and heard him answer it, and heard, in his voice, a quality that made her slow her steps without stopping. She had spent 9 years learning to read the sounds people made when they received information that changed the operational picture. She heard it now. She kept walking. She consulted with Vance for 22 minutes about Reyes's post-operative management, the antibiotic course, the drain placement, the monitoring parameters. Vance was good, thorough and honest, and not precious about incorporating her input, which was rarer than it should have been. When she came back out, Webb was standing in the corridor. His face was the face of someone who had received information and was managing it. What? She said. He looked at her. Ardenvale, he said. Okafor's situation. Tell me. It's not about your certifications. He paused. Diane Kopp withdrew her complaint this morning, like she said she would. But someone else filed one. Who? The hospital's legal counsel. He paused again. Acting on behalf of a board member who is arguing that your presence in the trauma bay last night, specifically the chest tube procedure, represents an unauthorized medical intervention that exposed the hospital to significant liability. They're not just terminating the placement contract. Nora was very still. They're filing a formal complaint with the state nursing board, Webb said, against your license. The corridor was bright and clean and completely quiet except for the ventilation system. They're trying to take my license, she said. Yes. She stood with that for a moment. Not panicking. She didn't panic. She hadn't panicked in 9 years, and she wasn't going to start in a hospital corridor in Clearwater. But she held the weight of it because it deserved to be held and not minimized. A nursing license was not an abstract thing. It was the mechanism by which she existed in the world she had chosen, the thing that made ordinary possible, the thing that made Ardenvale possible, and any Ardenvale after it possible. Without it, the supply cart and the linen audit and the quiet shifts were not an option. Without it, there was no ordinary. Who is the board member? She asked. Webb looked at his phone. A man named Gerald Wicker, he said, board member for 6 years, former hospital administrator. The name didn't connect immediately. Then it did. She looked at Webb. Gerald, she said. He looked at her. The cardiac patient, she said. Gerald, the 58-year-old who came in with back pain. Webb was very still. Diane's uncle, she said. The man I told them to run troponins on. She held Webb's gaze. The man who had an MI and went to the cath lab and is alive right now because the resident listened to me. The corridor was very quiet. His name is Gerald Wicker, she said slowly. Yes. He's on the board. Yes. She looked at the floor. She looked at it for a long time. He's filing a complaint against my license, she said, for intervening to save his life. Webb said nothing. There was nothing useful to say. And in that moment, in the clean, bright corridor of Clearwater Regional Medical Center, Nora Voss understood with the particular clarity of someone who has just had the map of a situation turned completely upside down that the night was not over, that the situation was not contained, and that the person filing a formal complaint against her nursing license was the same man who was alive this morning because she had pushed through a curtain and said the right thing to a resident who had been uncertain. She put her hand in her breast pocket. She felt the badge. Nora Voss, float nurse, Ardenvale Memorial. She took her hand back out. I need a phone, she said, and I need the number for the state nursing board's after-hours emergency line. Webb looked at her. Why after-hours emergency? Because if they file before I respond, I lose the narrative, she said. And I am not losing the narrative. She held out her hand for his phone, and from somewhere deeper in the hospital, a code alert began to sound. Not in Reyes's wing, not in Torres's room, but in the main ER reception, 3 floors below them. A code that came with an announcement over the PA that made every person in the corridor lift their heads. Nora heard it. She heard the details embedded in the announcement. She heard the patient category. She lowered her hand. What wing is the ER? She said to the nearest staff member, a passing nurse who stopped at the question. Ground floor, east side? How do I get there fast? The nurse pointed. Nora was already moving. Nora, Webb said behind her. Come or don't, she said without looking back. Because the code that had just gone out over the PA at Clearwater Regional Medical Center was a pediatric trauma alert, multi-casualty, incoming, ETA, 4 minutes, and the detail embedded in the announcement, the one that had made her start moving before she consciously decided to, was that the incident involved a school bus, and the number of patients expected was 11, and the hospital's pediatric trauma specialist was off-site. She had 4 minutes. She pushed through the stairwell door. The stairwell door hit the wall behind her, and she was already 3 steps down before it finished swinging. 3 floors. She took them the way she had taken stairs in buildings that were on fire, in buildings where the power was out, in buildings where the correct speed was faster than felt safe, and slower than panic. Controlled, not reckless, because reckless on stairs with a medical bag got you to the bottom faster than intended, and in worse condition than you needed to be. Webb's footsteps hit the stairwell behind her. She didn't look back. Ground floor, east side. She had processed the directions and was running the building layout in her head from what she'd seen on the way in, the way she always mapped buildings when she entered them, automatically, without deciding to. The habit so old it didn't feel like a habit anymore. She came through the ground floor door into a corridor that was already different from the one she'd left. Busier. Sharper. The particular organized urgency of a facility activating for a mass casualty event. Staff were moving with purpose. Someone was on a radio. A supply cart had been pulled into the hallway with pediatric equipment staged on it. Cervical collars in multiple sizes, pediatric BVM assemblies, IV kits with small gauge needles. Whoever had staged that cart knew what they were doing. She moved toward the ER entrance. The attending on duty for the ER was a man named Dr. Ferris Okafor. No relation to Philip, she would learn later, just a coincidence of names that the universe apparently found amusing. He was standing near the ambulance bay doors with a charge nurse and 2 residents, running through the inbound information. "What do we have?" Nora said, arriving at his shoulder. He looked at her. She was wearing clothes that were clearly not Clearwater staff issue. Yara's tactical pants and a dark pullover, the jump kit over one shoulder, the Ardenvale float badge in her pocket where it couldn't create confusion she didn't have time to manage. "And you are?" he said. "Trauma nurse. I was consulting upstairs. What do we have?" His assessment of her took approximately 2 seconds, the speed and the bag and the directness and the lack of apology, and he made the calculation fast, which told her something useful about him. School bus, partial rollover, 11 pediatric patients, ages 6 to 14 estimated. First units on scene but are reporting mixed severity. Walking wounded to at least 2 critical. Our pediatric trauma attending is 40 minutes out. "Do you have a pediatric surgery consult in-house?" "Dr. Sato, she's being paged." "Airway equipment?" "Staged." "Smallest ET tube size you have staged?" He looked at the charge nurse, who said, "We have down to a 3.0. Stage a 2.5 as well. Bus rollover with mixed ages, you'll have kids younger than the manifest says." The charge nurse wrote it down without asking why. The ambulance bay doors opened. The first unit arrived at 3 minutes and 40 seconds after the code announcement, which was faster than the estimated 4 minutes, and meant the scene was closer than dispatch had initially reported. 2 paramedics, 1 pediatric patient on a backboard, a girl, Nora estimated 9 or 10 years old, conscious and crying, which was information. Crying meant airway patent, meant she had enough respiratory reserve to be distressed, meant she was not the most critical patient in this event. She let the residents take the first patient. She positioned herself at the bay doors. The second unit came in 90 seconds later. This one was different. The boy on the stretcher was approximately 7 years old and not crying, which was the opposite of reassuring. His color was wrong. His respiratory pattern was wrong. Nasal flaring, accessory muscle use, the particular effort of a child whose body was working very hard to do something that was supposed to be automatic. "What happened?" she asked the paramedic on the left as they rolled. "He was in the front left quadrant of the bus. Impact side. Initial GCS at scene was 12, dropped to 9 in transport. Breath sounds decreased on the left." Nora was beside the stretcher, moving with it. She put her hand on the boy's chest. She felt the respiratory effort. She looked at his neck. "Tracheal deviation?" she asked the paramedic. "Subtle. Maybe. Not maybe." She could see it. A small but real shift. The trachea pushed fractionally right by pressure accumulating on the left. "He's tensioning," she said. She looked up. "Ferris. Bay 1. Now." Dr. Ferris Okafor was at her left shoulder in 4 steps. He looked at the child. He looked at Nora. "Needle D," she said. "Left second intercostal, mid-clavicular. Do you want to do it or do you want me to?" 1 second, 1 beat of a decision. "Walk me through it," he said, which was the right answer. Not because he didn't know the procedure, but because she had seen what he hadn't yet had time to see, and her read was faster and he was smart enough to know it. She talked. He moved. His hands were confident, and the needle went in correctly, and the hiss of air that followed was immediate and significant. The boy's color changed within 30 seconds. Not all the way to fine, but to better, which was what they had. He needs imaging and likely a chest tube, she said. Pediatric sizing. You want a 20 to 24 French, not the adult kit. I know, Ferris said. He was already at the boy's head, reassessing. Good call. She was already moving toward the next bay. The next 2 hours were the kind of work that stripped everything else away. Not because it was the hardest work she had ever done. It wasn't, not by a significant margin, because she had done this in conditions that made Clearwater Regional's ER look like an ideal training environment, but because it was real and urgent and required all of her and left nothing over for anything else, which was the quality of mass casualty response that she had always found simultaneously brutal and clarifying. 11 patients, 2 critical, 4 serious, 5 walking wounded with injuries ranging from lacerations to probable fractures. She moved between them with the systematic efficiency of triage discipline, constantly reassessing, constantly reprioritizing, not attached to any single patient, because attachment to a single patient in a mass casualty event was how you missed the one who needed you most. Dr. Sato arrived at 38 minutes. She was a pediatric surgeon in her early 40s who had the compressed energy of someone pulled from something and still fully functional, and she assessed the room in the way of someone experienced enough to update a complex picture quickly. She looked at Nora. You the one who caught the tension pneumo? Yes. And the fluid management on the 2 abdominal contusions? Ferris and I together. Sato looked at Ferris, who nodded once. Good, she said, and moved to the most critical patient, which was the right move and the only comment she needed to make. By 11:30 a.m., both critical patients were in the OR. The boy with the tension pneumo, who had turned out to have a hemopneumo requiring a chest tube exactly as Nora had predicted, and a 12-year-old girl with a splenic laceration that Sato had identified in imaging and moved on immediately. The serious patients were in monitored beds. The walking wounded had been assessed, treated, and were waiting for family. The ER was still busy. It was always busy. But it had downshifted from mass casualty intensity to standard trauma pace, the particular deceleration that came after a surge when the immediate crisis was contained, and what remained was the sustained work of monitoring and managing. Nora stood at the sink in the staff bathroom off the main corridor and washed her hands for the 3rd time. She looked at herself in the mirror. She looked like someone who had been awake for 26 hours. She looked like what she was. She dried her hands. She took out Webb's phone, which he had given her in the stairwell, with the particular efficiency of a man who understood that she needed it and that explaining why was unnecessary. She looked at the screen. 3 missed calls from an Ardenvale number. She called it back. Philip Okafor answered on the first ring, which told her he had been waiting. Nora, he said. I'm at Clearwater, she said. We had a mass casualty event in their ER. I'm available now. A pause that contained several things. I heard, he said. Dr. Vance called me. Another pause. He said you responded to a pediatric mass casualty with 11 patients and managed triage alongside their attending until their specialist arrived. Yes. This is the 2nd hospital in 12 hours where you've responded to an emergency that wasn't your assigned role. She waited. I'm not saying that as a criticism, Okafor said carefully. I'm saying it because I need you to understand the context in which the board complaint is landing. Because from where I sit, it looks like what you do is show up and save people. And from where Gerald Wicker sits, it looks like liability. He's alive, she said, because I showed up. I know that. Does he? A longer pause. Gerald Wicker has been on this board for 6 years, Okafor said. He is a complicated man. His relationship with the hospital is financial and administrative. He doesn't have a medical background, and he doesn't always make medical decisions when he's making what look like medical decisions. He paused again. What he has is a history of protecting the institution from liability exposure. And in his framework, what you did, an uncredentialed temporary staff member performing a chest tube procedure, chest poids, is exactly the kind of exposure he was put on the board to prevent. Uncredentialed, Nora said, In terms of how your record was filed with the agency, yes. Your advanced certifications weren't listed. They weren't required for the role I applied for. I understand that. Our legal counsel understands that. What Gerald understands is that a float nurse performed a procedure that is outside standard nursing scope, and that if the outcome had been different, we would be in litigation. Nora looked at herself in the bathroom mirror. The outcome wasn't different, she said. No, Okafor said quietly. It wasn't. She heard something in his voice, not agreement exactly, but something adjacent to it. The sound of a man who was navigating a gap between what he knew to be true and what his institution's machinery was producing. What happens next, she said. The complaint to the nursing board was filed this morning, Okafor said. At 7:42 a.m. Gerald moved quickly. He paused. The board is required to acknowledge and initiate a review. That process typically takes 4 to 8 weeks, during which your license remains valid but the complaint is on record. And my placement contract? Silence. Gerald has asked me to terminate it, Okafor said. Today. She held the phone. She held it and looked at the mirror and at the woman in it, who had been awake for 26 hours and had placed a chest tube and managed a field abdominal trauma, and called 4 minutes of a pediatric multi-casualty event, and had done all of it not because anyone asked her to, but because she was built in a way that responded to need, the way a compass responded to magnetic north, automatically, without choice, without the option of looking away. Are you going to? She said. Another pause. I don't want to, he said. That's not what I asked. No, he said. It's not. He took a breath. There is a board meeting tonight, emergency session. Gerald requested it to formalize the complaint and the contract termination. I can push back, but Gerald has 3 board allies who will vote with him, and that's enough for a majority. Who else is on the board? 7 members total. Gerald has 3. I need 4 to block him. What's the 4th vote? Silence. That's what I'm working on, Okafor said. Webb was in the family waiting room when she came back. He had acquired coffee from somewhere and was reading something on his phone with the focused quiet of a man processing information he was going to need to use. She sat across from him. She told him about the board meeting. He listened without interrupting, which was the second thing she respected most about him, the first being that he knew when to stop talking. When she finished, he said, "What do you need?" "The document folder," she said. "The one you gave Okafor last night." "What about it?" "How much of it is classified?" He thought about that. "The commendations and the service record are not classified. The specific operational details are." "Can you produce a version for the board, names and dates and decorations without the operational details?" "Yes." "How fast?" "I can have it in 3 hours." She nodded. "I also need something else," she said. He waited. "Gerald Wicker," she said. "He's a board member and a former hospital administrator. I need to understand why a man who had an MI last night and was saved by the intervention he's now complaining about would file a complaint before he was even discharged." Webb's expression shifted slightly. "He filed from the hospital?" "From the cardiac unit." She paused. "At 7:42 a.m., which means he was in a hospital bed when he had someone file a formal complaint against the nurse who told the resident to run troponins." Webb looked at her. "That's an interesting choice," he said. "It's a specific choice," she said. "I want to know what's driving it. Because it's not liability logic. A man who just had an MI doesn't call his lawyer from a hospital bed to file a nursing board complaint because he's worried about institutional liability. That's a different motivation." Webb put down his phone. "What do you think it is?" he said. "I think he was embarrassed," she said. "I think a float nurse walked into the bay where his niece's relative was being treated and said the resident was wrong and she was right in front of staff who know him. And I think that landed somewhere specific for a man like Gerald Wicker." Webb considered that. "Pride," he said. "Pride," she agreed, "and control. He spent 6 years as the person who manages liability exposure for a hospital. A float nurse with a supply cart just exposed a diagnostic gap in front of his niece, and the attending and anyone else who was in earshot." She paused. "He didn't file a complaint because he thinks I was wrong. He filed it because I was right, and he needed to do something with that. Webb was quiet for a moment. "That's a good read," he said. "It doesn't help me," she said. "It might," he said. "If the board meeting is tonight and Okafor needs a fourth vote, the argument that moves that vote is not procedural. It's not about certifications or scope. It's about the fact that a board member used institutional machinery to retaliate against a medical professional for a personal reason." She looked at him. "That's a serious allegation," she said. "It is," he agreed. "Do you want to make it?" She thought about that for a long time. She thought about the kind of long time that contained the understanding of what making that allegation would mean, not the risk to herself, which she was capable of calculating and had already partially calculated, but the shape of it, the commitment of it, the fact that once you said a thing like that in a room with institutional stakes, you were not unsaying it, and you were not stepping back from it. She thought about the boy in Bay 1 with the tracheal deviation. She thought about Danny Orr's chart. She thought about the supply closet audit she had never finished. "Yes," she said, "but I need evidence, not just logic." "What kind of evidence?" "Timeline," she said. "The complaint was filed at 7:42 a.m. I need to know what Gerald Wicker did between the time he was admitted to the cardiac unit and 7:42, who he called, whether he spoke to legal counsel before or after he spoke to Diane, whether Diane knew he was filing before or after she withdrew her own complaint." Webb looked at his phone. "That's going to require some conversations I'm not supposed to have," he said. "I know." He picked the phone up. "Give me 2 hours," he said. The 2 hours Nora had were not empty hours. Dr. Vance found her in the family waiting room at 12:30 and asked if she would be willing to consult on Reyes's post-operative course, which she would, and which took 40 minutes of focused work that she was glad to do because it gave her hands and her mind something concrete while the other machinery ran in the background. Reyes was in recovery and awake when she stopped by. He looked worse than he had before surgery, which was normal. Surgery did that, particularly abdominal surgery, the body processing the insult of necessary repair alongside the insult of the original injury. But his eyes were clear, and his vitals were tracking the right direction, and when she came to the bedside, he looked at her with the specific expression of someone who had been given information they were still processing. "They said you made the calls in the field," he said. "Some of them. The fluid management, the decision to move." "Yes." He was quiet for a moment. His hands were on the blanket, IV lines running from the back of the left one, and he looked at them the way people looked at their own hands when they were thinking about something that wasn't their hands. "I know who you are," he said. "Webb told me." He paused. "When I was in the field, before you got there, I kept thinking, if Raven were here, that's the thing that kept going through my head." He looked up. "I didn't know you were an hour away restocking linen carts." She almost smiled. "Nobody did," she said. "Is that why you left?" he said. "So nobody would know?" She thought about how to answer that honestly without answering more than was useful. "I needed something that wasn't this," she said. "For a while." "Did you find it?" She looked at the window, at the afternoon light outside Clearwater Regional Medical Center that was doing nothing in particular, just existing, the way light did. "Almost," she said. Manmindab. Webb called her at 2:14 p.m. She was in the corridor outside the family waiting room, which had become something like her operational base by default, the place she returned to between everything else the way soldiers return to staging areas. "I have the timeline," he said. "Tell me." Gerald Wicker was admitted to the Ardenvale Cardiac Unit at 11:40 p.m. His niece, Diane Kopp, visited him at 12:15 a.m. They were alone for approximately 20 minutes. Diane left. At 1:07 a.m., Gerald made a phone call to a number registered to Harlan Peck, who is Ardenvale Memorial's outside legal counsel. "That's before Diane withdrew her complaint," Nora said. "By approximately 3 hours, yes." He paused. The call to Peck lasted 11 minutes. At 7:30 a.m., 12 minutes before the nursing board complaint was filed, Peck called Gerald back. The complaint was filed at 7:42. So Gerald called the lawyer before Diane withdrew her complaint, Nora said, which means he knew about her complaint when he was admitted. She presumably told him when she visited, and instead of being grateful that someone intervened in his care, he immediately called legal counsel to discuss options. She held the phone. He used Diane's complaint as the template and filed his own through the hospital's outside counsel. Yes. But Diane's complaint was about scope of practice. Gerald's complaint to the nursing board is about unauthorized medical decision-making causing liability exposure. She thought about it. Gerald upgraded the complaint, made it more formal, more consequential. Yes. And he did it from a hospital bed 12 hours after a cardiac event, before his niece withdrew her complaint, which means... She stopped. Which means he didn't consult Diane about filing, Webb said. He used the information she gave him and acted on it independently. There was a moment. Does Diane know he filed? Nora asked. Based on what I can determine, no, not yet. Nora leaned against the corridor wall. She looked at the ceiling. She thought about Diane Kopp standing at the foot of Danny Orr's ICU bed at 4 a.m. in street clothes saying, "He's my uncle." She thought about the difficulty in Diane's voice when she said, "I can withdraw it." She thought about what it cost someone who had operated on authority for 11 years to walk back into that hospital at 4 a.m. and say they had been wrong. She thought about what it was going to cost Diane to find out that her uncle had taken the information she gave him and turned it into something she had already decided not to pursue. "There's one more thing," Webb said. "What?" "Gerald Wicker's board position," he said. "He's been on the board 6 years. Before that, he was an administrator at a hospital in the same regional network as Ardenvale. He left that position, not voluntarily, based on what I can find, following a complaint filed by nursing staff about administrative retaliation against clinical staff who raised safety concerns." Nora went very still. "He has a prior," she said. "Not a criminal record, an administrative record. A settled complaint, confidential terms, but the record of the complaint itself is accessible through the state health department's public filings, if you know what to look for." And someone looked. "Someone looked," Webb confirmed. She was quiet. Outside the windows of Clearwater Regional, the afternoon had gone flat and bright, the kind of afternoon that contained nothing dramatic except what people were doing inside the buildings under it. "I need to be at that board meeting," she said. "Okafor hasn't said you can attend." "I'm not asking Okafor," she said. "It's a board meeting about a complaint filed against me. I have standing to request a hearing. Do you know how to request one?" "I'm about to find out," she said. She looked at the badge in her hand. She had taken it out without thinking about it. The float nurse badge, Ardenvale Memorial, Nora Voss. And she was holding it the way she held things she was deciding about. She put it back in her pocket. She called Okafor's office line. His assistant answered, and Nora said she needed 5 minutes with the director before the board meeting tonight. And the assistant said she would check his availability, and Nora said she needed confirmation in the next 30 minutes because she had logistics to manage, which was true in several senses. While she was waiting, Webb appeared from the direction of the family room. He had 2 things: the clean document package he had promised, the service record and commendations, classified operational details removed, everything else intact, and an expression that said he had one more piece of information. "What?" she said. He handed her the document package. Then he said, "Diane called Gerald this afternoon." Nora looked at him. "When?" "About 40 minutes ago. She found out about the nursing board complaint from someone in hospital administration who mentioned it thinking she already knew." He paused. "She didn't take it well." "How do you know this?" "Because 20 minutes after Diane called Gerald, she called Okafor's office and asked to speak at the board meeting tonight." The corridor was very quiet. "Diane wants to speak at the board meeting," Nora said slowly. "Yes." "Against the complaint?" "That would be my read." Nora held the document package. She looked at it. She thought about the 4th vote Okafor needed. She thought about a woman who had spent 11 years building authority in a place and had spent the last 24 hours having that authority slowly disassembled by the consequences of her own choices, and who had apparently decided to do something about at least one of those consequences. She thought about the fact that Gerald Wicker had used his niece's information without telling her what he was going to do with it. He didn't tell her, Nora said. He knew she was going to withdraw the complaint, and he filed before she could because he knew if she found out she'd tell him not to. Webb said nothing because she was thinking out loud and he knew the difference. He knew, she said again, which means this wasn't about liability. If it were about liability, he would have coordinated with Diane and they would have filed together through the hospital's legal channel, not through the nursing board. This was about Gerald doing something with what Diane told him before Diane could change her mind. She looked at Webb. He used her, she said, the same way he used his administrative position at his last hospital, the same pattern. Yes, Webb said. And in about, she checked the time, 6 hours, he's going to walk into a board meeting expecting to formalize a complaint against my license with 3 allies and a majority, and he's going to find his niece in that room. Webb held her gaze. And you, he said. And me, she agreed. She put the document package under her arm. She thought about the shape of the next 6 hours, the logistics of getting from Clearwater to Ardenvale in time, the preparation she needed to do, the specific arguments that would matter in a room full of board members who were not medical professionals and needed to understand a medical situation in terms they could act on. She thought about all of it, and then Okafor's assistant called back and said the director had 15 minutes available at 5 p.m. before the board convened, and Nora said she would be there, and she ended the call. She looked at Webb. I need a vehicle back to Ardenvale, she said. Already arranged, he said. She almost asked how, then didn't, because the answer was that Webb operated in the way of people who solved logistical problems before they were asked, and asking him to explain it was just using time she needed for something else. One more thing, she said. What? Danny Orr, she said. He's still in the ICU at Ardenvale. I want to check in with Renfrew before the meeting. We'll have time, she nodded. She started toward the exit. Behind her, in the OR recovery suite 2 floors up, Dominic Reyes was sleeping the chemical sleep of the post-operative patient, his abdominal wound sutured and drained, his vitals tracking in the right direction for the first time in 16 hours. Torres was in the orthopedic unit with a vascular surgeon's handprint on her chart and a clear plan for the leg. The boy with the tension pneumo was breathing on his own in the pediatric ICU. Everyone she had touched in the last 12 hours was still alive. All of them. That was not a perfect record. She had worked with imperfect records before and understood what they cost. But it was the record she had, and she was going to walk into a board meeting tonight with it, and with a service record, and with a prior administrative complaint from a state health department database, and with whatever Diane Kopp had decided to do with the information that her uncle had used her. She pushed through the exit door into the afternoon. The light was flat and ordinary. She kept moving. And in the Ardenvale Memorial boardroom, Gerald Wicker was preparing for a meeting he had controlled from the moment he made his first phone call from a cardiac unit bed at 1:07 a.m. A meeting he had spent 14 hours constructing with the meticulous care of a man who had done this kind of thing before and believed he understood exactly how it ended. He had not yet been told that his niece had called the hospital director. He had not yet been told that the float nurse he was trying to remove had been at Clearwater Regional for the last 6 hours, doing things that were now on the record of a second institution. He had not yet been told about the document package. He had not yet been told any of the things that were going to be in that room when he walked into it. He was preparing for the meeting he had planned. He was walking into a different one entirely. The drive back to Ardenvale took 53 minutes. Webb drove. Nora sat in the passenger seat with the document package on her lap, and her eyes on the road, and her mind doing what it did in transit, running forward, mapping the room she hadn't been in yet, building the argument from the materials she had. She had done this before with less. She had done this in vehicles that were moving toward things considerably more dangerous than a hospital board meeting, with less sleep and worse information, and no guarantee that the situation would be what she expected when she arrived. She knew how to use transit time. She knew how to arrive ready. What she was less certain about was the human variable. Diane Kopp, a woman Nora had known for 6 weeks without knowing at all, who had spent most of that time making her professional life smaller, who had stood at a bedside at 4 in the morning and chosen honesty over self-protection, and who had apparently spent the afternoon discovering that the person she'd protected was her uncle, and the thing she'd protected him from was knowledge of what he'd done. That was not a clean situation. That was a person in the middle of something that had no comfortable position in it. Nora looked at the road. She thought about what she was going to say to Okafor. She thought about what she was not going to say, which was equally important, because the argument she was building needed to be precise and not personal. And the difference between those two things in a boardroom was the difference between being heard and being dismissed. She was not going to tell the board that Gerald Wicker had embarrassed her. She was going to show them what Gerald Wicker had done. Those were different statements with different weight. Ardenval Memorial looked the same as it always looked from the parking lot. The same institutional facade, the same entrance, the same ambulance bay where 3 military helicopters had sat with their navigation lights blinking approximately 17 hours ago. It looked like a building that didn't know what had happened inside it last night, which was how buildings always looked. She went to the ICU first. Danny Orr was awake. He was sitting up slightly, still with the chest tube in place, still on monitoring, but with color that was close to what it probably looked like normally, and eyes that tracked her when she came through the bay door with the particular alertness of someone who had been waiting. "Hey," he said. "Hey." She checked the tube output. On target. She checked his chart. Renfrew's notes from the morning, Thoracic's afternoon check-in, all of it consistent and moving in the right direction. "How are you feeling?" "Like someone put a tube in my chest." "Because someone did." She reviewed the most recent vitals. "You're on track for tube removal tomorrow if the overnight drainage stays where it is." "Webb told me you left." He paused, and then came back. "I came back for a meeting." He looked at her with the expression of someone who understood there was more to that sentence and was deciding whether to push on it. "Are you okay?" he asked. It was a simple question. She had been asked it approximately twice in the last 24 hours, which was twice more than the average deployment, and both times it had caught her slightly off guard in a way she couldn't entirely account for. "I'm working on it," she said, which was honest. He nodded, accepting that the way soldiers accepted things that were honest but incomplete. "Thank you," he said, "for last night." She looked at him. He looked back without flinching, which told her he meant it as a fact and not a performance. "You're welcome," she said. She left the chart where it was and walked out. Philip Okafor's office was on the 4th floor, administrative wing, with the kind of furniture that said the hospital took itself seriously without being extravagant about it. He was standing when she came in, which she noted, not sitting behind the desk in the position of institutional authority, but standing near the window with the posture of a man who hadn't been sitting much today. He looked at her the way he had looked at the document folder last night, like someone recalculating. "You came from Clearwater," he said. "Yes." "Vance called me again, after the mass casualty event." He paused. He said 11 pediatric patients and you were the first clinical responder on 2 of the criticals. Ferris Okafor, your ER attending, was running triage. I assisted. The tension pneumo. "Yes." Okafor moved away from the window. He sat, finally, in the chair to the side of his desk rather than behind it, which was the choice of someone who wanted to have a conversation rather than conduct one. "Tell me what you need tonight," he said. She sat across from him. She put the document package on the table between them. "I need 5 minutes to speak to the board before Gerald presents his complaint," she said. "Not after, before. The order matters." "That's irregular." Gerald Wicker filing a nursing board complaint against the nurse who saved his life from a hospital bed the morning after his M1 is also irregular, she said. "I'm comfortable with irregular." Okafor looked at the document package. "What's in there?" "My service record. Commendations. 9 years of documented field work. The credentials Gerald's complaint implies don't exist." She paused. "And a public filing from the state health department. A prior administrative complaint against Gerald Wicker from his last hospital. Retaliation against clinical staff who raised safety concerns. Settled confidential terms, but the complaint record is public." Okafor was very still. "He has a prior," he said. "A pattern," she said, "which is different from a prior in the way that matters." He looked at the package for a long moment. Then he looked at her. "Diane called me," he said. "I know. She's coming tonight." "I know that too." He studied her. He was a man in his 50s who had run a hospital for 11 years through budget cycles and accreditation reviews and staff disputes an occasional genuine crises, and he had the quality of someone who had learned to read situations not from what people said, but from what they didn't say, and from how they held themselves when the stakes were real. "You've done this before," he said. "This specific thing. Walking into a room with institutional machinery pointed at you and making an argument." "Different rooms," she said. "Same structure." He was quiet for a moment. "I'll give you 5 minutes before Gerald speaks," he said. "That's what I can do." "That's enough," she said. The Ardenvale Memorial Boardroom was on the 4th floor, down the corridor from Okafor's office, and it was the kind of room that communicated its own importance without being ostentatious about it. A long table, 12 chairs, wall-mounted screens for presentations, recessed lighting that was professional rather than warm. Gerald Wicker was already there when Nora arrived. He was seated to the right of the head chair, with the particular settled quality of a man who had arrived early to a room he expected to control. He was 61 years old, still in the slightly worn quality of someone recently discharged from a cardiac unit. She could see it in the pallor that hadn't quite resolved and the careful way he moved, but he had dressed formally, which was a choice that told her something about how he understood tonight. He looked at her when she came in. Something moved through his face, not fear, not guilt, something more complicated and less clean. The expression of a man encountering a variable he had not adequately accounted for. He said nothing. She said nothing. She took a seat on the opposite side of the table, 3 chairs down, and set the document package in front of her and folded her hands on top of it and waited the way she had learned to wait in environments where waiting was its own form of communication. The other board members filed in over the next 10 minutes. 3 of them Nora identified as Gerald's allies from their body language. The way they oriented toward him when they sat. The small acknowledging nods he gave them that said they had spoken beforehand. 3 others were genuinely neutral, reading the room with the expressions of people who had received an emergency meeting notification and were not yet certain what they were walking into. The 7th board member arrived last. Her name was Dr. Constance Mbeki, and she was the only physician on the board. A retired cardiologist in her late 60s, who had the bearing of someone who had spent 40 years in rooms where people talked around the actual issue and had lost patience with it sometime in the mid-90s. She sat at the far end of the table and looked at Nora with direct, unhurried attention. Okafor called the meeting to order at 6:04 p.m. He gave Nora her 5 minutes first. Gerald started to object. "The standard procedure is for the complaint to be presented before," and Okafor said, "This is my meeting, Gerald, and we're going to hear from Ms. Voss first," and the flatness in his voice settled the objection before it finished forming. Nora stood. She did not open the document package yet. She said, "Last night at approximately 10 p.m., a soldier arrived at this hospital in hemorrhagic shock with a penetrating thoracic injury. The trauma-based staff responded appropriately. I assisted with a chest tube procedure that stabilized him. He is alive and recovering in the ICU 1 floor above us." She paused. At approximately 9:45 p.m., several hours before that soldier arrived, a patient named Gerald Wicker presented to this ER with back pain. I was working a supply cart 6 feet from his bay. I observed symptom presentation consistent with cardiac involvement, referred shoulder pain, atypical diaphoresis, blood pressure discrepancy, and I told the resident to run troponin levels. Mr. Wicker subsequently had an MI and was transferred to the cath lab. He is alive. She let that sit for a moment. At 7:42 this morning, while still a patient in this hospital's cardiac unit, Mr. Wicker directed outside legal counsel to file a formal complaint with the state nursing board against my license. She opened the document package. The complaint alleges unauthorized medical decision-making and liability exposure. I want to show you 3 things. She passed the first set of pages to the board member nearest her and gestured for them to be distributed. This is my service record, 9 years of combat trauma nursing, advanced surgical assist certification, tactical emergency medical support, multiple commendations. This is not a complete record. Some elements remain classified. But what you're holding is accurate and verifiable. She paused. These credentials were not filed with the placement agency because they were not required for the position I applied for. Float nurse positions require a valid nursing license and basic certifications, both of which I hold. I was not asked for more. I did not volunteer more. That is not concealment. That is a routine application." She passed the second set of pages. "This is a public record filing from the State Health Department, a complaint against Gerald Wicker filed during his tenure as administrator at Harlow Regional Medical Center 5 years before he joined this board. The complaint was filed by nursing staff. The allegation was administrative retaliation against clinical employees who raised patient safety concerns. The complaint was settled under confidential terms. The record of the complaint is public." The room had changed quality. She could feel it. The shift in attention, the small adjustments of posture, the way Dr. Mbicki's eyes had moved from the pages to Gerald Wicker and stayed there. Gerald was looking at the table. "The pattern," Nora said, "is consistent. A clinical staff member identifies a concern. An administrator responds not with investigation, but with institutional action against the staff member." She paused. "I told a resident to run troponins. The resident ran them. The patient lived. The administrator filed a licensing complaint." She looked at Gerald directly. "I am not arguing that scope of practice rules don't exist," she said. "I am arguing that this complaint is not about scope of practice. This complaint was filed from a hospital bed within hours of a cardiac event by a man whose life the evening's events had extended, directed at the person whose clinical observation had contributed to that extension. And it was filed before his niece, who had filed a separate complaint that she subsequently withdrew, was informed he was doing it. The door opened. Diane Kopp came in. She was in professional clothes, not scrubs, and she looked like a woman who had prepared for something difficult and was going to do it anyway. She took the empty chair at the near end of the table and sat without apology for the interruption. She looked at Gerald. He looked at her. It was the look of two people who had spoken on the phone approximately 3 hours ago in a conversation that had not gone the way he expected. Okafor said, "Diane, thank you for coming. You'll have the opportunity to speak." Nora sat down. She had said what she needed to say. The room did the rest. Gerald Wicker presented his complaint for 8 minutes. He was a practice speaker, a man who had spent 6 years in boardrooms and 11 before that in administrative roles, and who understood how to frame an argument in institutional language. He used words like protocol and exposure and standard of care and chain of accountability, and under other circumstances, in a room that hadn't already seen what the board had just read, his argument would have had significant weight. But the room had read the pages, and Dr. Constance Mbeki, who had spent 40 years in cardiology and understood what a float nurse seeing referred shoulder pain and atypical diaphoresis meant, was looking at Gerald Wicker with an expression that was doing something specific and not subtle. When Gerald finished, she said, "Gerald, the patient in Bay 7 last night, the cardiac patient." He looked at her. "Yes." The float nurse identified the presentation before the attending. The resident was running a workup. "The float nurse identified it," Mbeki said again. "Not aggressive, just precise. The precision of someone who had been a cardiologist for 40 years and knew exactly what identifying an atypical MI presentation meant. And you filed a licensing complaint against her the following morning." "The procedure, I'm not asking about the chest tube," Mbeki said. "I'm asking about the cardiac patient, about the scope of practice argument as it applies to a nurse observing symptom presentation and communicating it to a physician. That's not outside scope. That is nursing. That is exactly what nurses are supposed to do." She paused. "So the complaint, as you framed it, doesn't actually hold on the cardiac case, which means the chest tube is doing the heavy lifting. And the chest tube was performed in an emergency in the presence of the attending physician, who has stated in writing that he considered her actions appropriate under the circumstances." She looked around the table. "I'd like to hear from Diane," she said. Diane had been sitting with her hands flat on the table and her eyes on a point in the middle distance that was somewhere between the wall and the present. She looked at Mbeki when her name was said. She straightened. She said, "I filed a complaint yesterday about scope of practice. I withdrew it this morning because upon reflection, I concluded it was not the right action. What I said in that complaint was accurate, but the intent behind it wasn't procedural. I was managing my own response to a shift that challenged me in ways I hadn't expected." She paused. She looked at Gerald. I told my uncle about the events of last night when I visited him in the cardiac unit. I told him because he's family and he was there and it seemed relevant. I did not tell him so that he could file a licensing complaint. I did not know he was going to do that. I found out this afternoon. Another pause. Gerald has a history, she said. I know he has a history because when he was at Harlow Regional, I was working in the same network. I knew some of the staff who filed that complaint. I knew what the situation was. She stopped. I don't think Gerald's motivation is liability management. I think it is what Nora said it was, and I think the board should treat it accordingly. The room was completely quiet. Gerald looked at Diane. He looked at her the way family members looked at each other when a private understanding had been made public, when the thing you thought existed only between two people turned out to exist in a room full of others. He said, "Diane, don't," she said quietly. One word. He closed his mouth. Chum. The vote took 11 minutes, 5-2 against the complaint. The 5 including Mbeki, the 3 genuinely neutral members who had clearly made their decision during Mbeki's questioning, and Okafor as a non-voting facilitator whose position had been readable from the moment he gave Nora the 5 minutes. Gerald's 2 allies voted with him. The motion to formalize the complaint and terminate Nora's placement contract failed. The motion, introduced by Mbeki, seconded by a board member named Harrington who had barely spoken but had read every page of the document package with focused attention, to request a review of Gerald Wicker's conduct as it related to the prior administrative complaint record passed by the same margin. The review would be conducted by the board's ethics subcommittee. The finding would determine whether Gerald's board position was tenable. He understood what that meant. She could see it in the way he sat when the votes were read, the quality of a man who had walked into a room expecting to end someone else's situation and was leaving it with his own situation fundamentally altered. He did not look at Nora when he left. He did not look at Diane. He walked out with the 2 board members who had voted with him, and the door closed, and the room had the specific decompressed quality of a space after something has been decided. She was in the corridor outside the boardroom when Diane found her. Diane had the look of someone who had done something difficult and was not entirely sure how to stand in the aftermath of it. Not regret, something more complicated. The particular posture of a person whose relationship to a situation has been permanently rearranged. "I don't expect this to fix anything between us," Diane said. "It doesn't need to fix anything," Nora said. "I was wrong about how I treated you. Not just last night, the 6 weeks before it." Nora looked at her. There was no clean or easy answer to that, which was the honest truth about most apologies. They didn't undo the thing. They just acknowledged it and stood there with it. "I know why you did it," Nora said. "That doesn't make it okay, but I know why." Diane nodded. It was a nod that didn't ask for more than it was given, which was the right kind. "Are you coming back?" Diane asked. "To Ardenvale?" Nora looked at the corridor, at the hospital around her, the floors, the walls, the ambient sound of a medical institution running its overnight shift, the smell of antiseptic and recycled air that she had stopped noticing 6 weeks ago and was noticing now. "Yes," she said. She hadn't known that until she said it, which was sometimes how knowing worked. Diane nodded again. She walked back toward the elevator. Nora stood in the corridor for a moment. Webb appeared from the direction of the stairwell pit. He was constitutionally incapable of taking elevators in buildings he hadn't mapped, which was something she had observed about him years ago and was apparently still true, and stopped beside her. "How did it go?" he asked. 5-2. Something in his face relaxed by a small degree. "Gerald?" "Ethics review," she said. "Board position is probably not survivable." He was quiet for a moment. Then, "Good." They stood there in the corridor with the hospital running around them. "The 4 people," she said. "Reyes, Torres, the others, they're all going to be okay." "Yes." "You have what you need." "We have what we need," he said. She looked at him. "I'm not re-enlisting," she said. "I know. Whatever you're about to say." "I'm not about to say anything," he said. "I came to tell you that Yara's team is wheels up at 0700, and that Danny Orr is being transferred to a specialist facility in 2 days where he'll finish his recovery. and that I'll be submitting a recommendation that Ardenvale Memorial be designated a preferred civilian medical partner for regional special operations medical needs. He paused. Meaning you would have a formal consultative relationship with the unit. Not enlistment, not deployment, consultation, on your terms. She looked at him. He looked back. On my terms, she said. On your terms. She thought about what that meant, the specific shape of it, the difference between what she had walked away from and what he was describing. The difference was real. It was not a small difference. Let me think about it, she said. Take your time, he said. He said it with the ease of a man who genuinely meant it, and she believed him, because Webb had never in 9 years of her knowing him said something he didn't mean. Bitum. She stopped by Danny Orr's bay one more time before she left the hospital that night. He was asleep, real sleep, not the metabolizing unconsciousness of a body in crisis, but the deep, rhythmic sleep of a body beginning to repair. The monitor above him was quiet and steady. The chest tube output was where it needed to be. She stood in the doorway for a moment. She didn't go in. She looked at him. This young man with the tattoo on his forearm and the blank slack face of someone who would wake up tomorrow in significantly better condition than he had been in last night and would probably not spend adequate time understanding how close the margin had actually been. That was okay. That was how it was supposed to work. The people who made it through weren't supposed to fully comprehend the alternative. They were supposed to heal and go back to their lives and do whatever people did when they still had the option of doing things. She turned and walked toward the elevator. She pressed the button. She stood in the corridor of Ardenvale Memorial at 9:47 p.m. and waited, which was something she was good at, and thought about the supply cart on C corridor that still had a half-finished audit on it. And this time, for the first time in the 23 hours since she had abandoned it, the thought made her almost smile. She was going to finish that audit, not because it mattered in any grand sense, but because she had said she would do it, and she was the kind of person who finished what she started, even when the middle had contained 3 military helicopters and a pediatric mass casualty event and a board vote, and a man who had tried to take something from her that he didn't understand he couldn't have. Moms, there is a particular lie that institutions tell, and it is this: that a person's value is visible in the role they are assigned, that the badge they wear tells you what they're worth, that the title on the chart determines what the hands attached to it can do. It is a useful lie for institutions, because institutions run on hierarchy, and hierarchy requires people to stay in the positions they've been placed in, and the machinery breaks down when people refuse. But it is a lie nonetheless. And the cost of it, the diagnostic gaps, the missed presentations, the patients who got worse while someone waited for the right person with the right title to make a decision the wrong titled person in the room already knew, is a cost paid in something that doesn't appear on any institutional balance sheet. Nora Voss had known this for 9 years. She had known it in war zones where the person with the most experience was not the person with the most rank, where the decision that saved a life was made by whoever had the knowledge and the nerve and happened to be standing there. She had known it in supply closets. She had known it pushing carts. She had carried it quietly and done her job and watched, with the particular patience of someone who had stopped needing to be recognized in order to function, while the people around her made assumptions about what she was based on what she appeared to be. And she had learned, not easily, not once, but repeatedly, across a career that had cost her things she hadn't anticipated losing, that the quietest people in a room are often the ones who have the most to say, and that the person nobody is looking at is frequently the one who can see what everyone else is missing. She had not come to Ardenvale to prove that. She had come to rest. But sometimes the room you rest in catches fire, and you find out who you are by what you do when it does, not by what you planned to be before it started. The float nurse badge went back on her chest the next morning. She clipped it to the left breast pocket of her scrubs the way she had done every shift for 6 weeks, with the same absence of ceremony, and she picked up her assignment from the charge nurse station. A different charge nurse, not Diane. It was Diane's day off. And she reviewed it and took the cart she was given and started her shift. The first 2 hours were quiet. She restocked a medication cart in the East Wing. She helped an overnight resident find a patient's chart that had been misfiled. She sat with an elderly woman in the post-surgical ward who was frightened and alone at 3 a.m. and who needed someone to stay nearby more than she needed anything clinical. And Nora stayed because she had the time and because it was the job, and because the job was not always the dramatic version of itself. Dr. Renfrew found her at 6 a.m. She came around the corner with the expression she always had, slightly compressed, fully present, dispensing with preamble on principle. "Danny Orr," she said. "Tube comes out this morning. His pressure has been textbook overnight." "Good." "I reviewed your handoff notes again," Renfrew said. "The ones you wrote before you left yesterday morning." Nora waited. "In 22 years," Renfrew said, "those are the most thorough handoff notes I've received from a nursing staff member." She said it flatly, clinically, without performance. It was a statement of observed fact, the way she stated everything. Nora said, "I had a good teacher." "Who?" "Necessity," she said. Renfrew almost smiled. It was the same almost smile from the trauma bay, brief and real and then gone. "I'd like you in the trauma bay tonight if you're on shift," Renfrew said, "not as float, formally assigned." "That's a conversation for the charge nurse." "I've already had it," Renfrew said. "I'm having it with you now." She paused. "Is the answer yes?" Nora looked at the corridor, at the hospital around her, at the ordinary functioning morning of a place that had been, 24 hours ago, something considerably less ordinary. "Yes," she said. Renfrew nodded. She turned and walked back the way she had come, already on to the next thing, which was how she moved through the world and probably always had been. Nora picked up her cart. She pushed it toward the next supply station. She was a float nurse at Ardenvale Memorial Medical Center, and she was pushing a supply cart, and somewhere on the third floor, a young soldier was about to have a chest tube removed and was going to breathe easier than he had in 36 hours. And somewhere in a recovery suite in Clearwater, a man with a repaired bowel was eating clear liquids for the first time since before his injury. And somewhere in the pediatric wing of that same hospital, a 7-year-old boy was breathing on his own. And none of them knew her name, and that was fine. That had always been fine. She had not done it so they would know her name. She had done it because it needed doing, and she was there, and she knew how. The badge on her chest said Nora Voss, float nurse. It didn't say combat trauma specialist. It didn't say the call sign she had carried for 9 years in places that didn't appear on public maps. It didn't say anything about what her hands had done, or what her mind could read, or what she had learned in the particular brutal educational program of keeping people alive when the margin was 30 seconds and the equipment was whatever you happened to be carrying. But that was the thing about value that institutions had never quite figured out, and that the people inside them sometimes forgot, and that she had spent a career understanding in ways that went deeper than understanding. What you carry does not change based on what they write on the label. The cart moved. The corridor stretched ahead of her. She pushed it forward, steady, unhurried, already seen, but 3 rooms down, a medication cart with an IV setup that was flagged incorrectly, a detail nobody else had noticed yet, a detail that mattered. And she moved toward it the way she moved toward everything, without waiting to be asked, without needing to be seen, because the work was the work, and she was the person who knew how to do it, and that had always been enough. It was enough now.